शंखं चक्रं जलौकां दधतमृतं घटं चारुदौर्भिश्चतुर्भिः सूक्ष्मं स्वच्छातिरुद्यं शुकपरिविलसनम् मौलिमम्बोजनेत्रं कालाम्बोद्योज्ज्वलाङ्गं कटितटविलसश्च चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तव निखिलगदमिव प्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम्।
नमस्कार, गुड इवनिंग टू ऑल। आज के इस स्त्री रोग परिचर्चा के सत्र में आप सभी का बहुत बहुत स्वागत है। जैसा कि हम लोग आज यहाँ पर एक विशेष सत्र के लिए अभी इकट्ठा हुए हैं, इसी के साथ साथ जो भी आयुर्वेद गायनेकोलॉजी से जुड़े हुए हमारे वैद्यों के केस है, इसका डिस्कशन भी आज इस सत्र में होगा। आप सभी का बहुत बहुत स्वागत है। और आप भी इस परिचर्चा का अगर हिस्सा बनना चाहते हैं तो 9410379397 पर आप संपर्क कीजिए और आप भी इस परिचर्चा का हिस्सा बनिए। नमस्कार सभी को। अंजना मैम नमस्कार, डॉक्टर आदित्य, डॉक्टर सरिता, आप सभी को बहुत बहुत नमस्कार और स्वागत है आपका इस सत्र में। हम लोग हमारे पास थोड़ा सा समय, दो केसेस थे तो उसको डिस्कस कर लेते हैं, फिर हमारा आज का स्पीकर का सेशन होगा। यस डॉक्टर आदित्य, डॉक्टर सरिता। डॉक्टर आदित्य, बताइए आपको किस प्रकार से आपकी केस है या क्या है। मैम एक केस आई, तब तक मैं पढ़ती हूँ। अंजना मैम।
जी जी पढ़िए जी।
हाँ, वो मैडम अभी ज्वाइन नहीं हुए, संपदा मैडम, वो हम लोग देखते तब तक क्या उन्होंने कुछ शायद आईयूजीआर टाइप का कुछ केस डाला है। तो उसमें उन्होंने लिखा है कि आईयूजीआर विथ फीटोप्लेसेंटल इंसफिशियंसी और फिर ओलिगोमेनोरियाज मॉडरेट सीवियर ऐसे कुछ है। फिर लो लाइंग प्लेसेंटा भी लिखा है। और एएनसी केस है ये, और उसमें पीवी ब्लीडिंग बता रही है मैडम। लो लाइंग प्लेसेंटा है। प्रेगनेंसी विथ हाइपोथायरॉयडिज्म, प्रेगनेंसी विथ हाइपरथायरॉयडिज्म, प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन, सीवियर नोजिया वोमिटिंग है पेशेंट को फर्स्ट टाइमिस्टर से ही। अभी थोड़ा सा डायरिया भी है और एब्डोमिनल पेन ऐसे कुछ उन्होंने लिखा है। ड्यूरिंग प्रेगनेंसी ये सब लक्षण उनमें दिखते हैं। तो यहाँ पे देखिए उन्होंने दो भी लिखे हैं शायद, प्रेगनेंसी विथ हाइपोथायरॉयडिज्म, प्रेगनेंसी विथ हाइपरथायरॉयडिज्म। और प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन, ऐसा कुछ है। हम लोग कैसे विचार करेंगे मैम थायराइड को लेकर यहाँ पर। हाइपो और हाइपरथायरॉयडिज्म में किस प्रकार से हम लोग विचार करेंगे।
प्रेगनेंसी में मैडम जो है हम लोग को पहले तो यही देखना होता है ना कि वो बिफोर प्रेगनेंसी स्टेट क्या था और ड्यूरिंग प्रेगनेंसी स्टेट क्या था। और क्योंकि अगर जैसे कहते हैं कि अगर मैलिग्नेंट है या ज्यादा कंडीशंस जो है वो हार्मोन्स की जो है डिस्टर्ब है, तब तो फिर हमको मॉडर्न मेडिसिन का सहारा लेना है। अगर वो प्री प्रेगनेंसी नहीं था, ड्यूरिंग प्रेगनेंसी था, तो समटाइम्स हार्मोनल डिस्टर्बेंस ऐसा होता है, तो हमें तुरंत मेडिसिन स्टार्ट नहीं करना है। कुछ पेशेंट ऐसे होते हैं वो हायर 100 mg की थायरोनॉम जो है वो बहुत कम उम्र से लेना शुरू कर देते हैं, या उनको सही में बहुत ज्यादा हाइपरथायरॉयडिज्म या हाइपरथायरॉयडिज्म की कंप्लेन होती है। तो हमें डिपेंड इस पे करना होता है कि डायग्नोसिस हमारी किधर की तरफ जा रही है, क्योंकि जो इसमें बहुत अर्ली डिसीजन नहीं लेना है कि हमें तुरंत
नहीं
पेशेंट
लेना
को
है।
थायराइड पे लेना है जी। फर्स्ट टाइम स्टेप पे हमें थोड़ा वेट एंड वॉच करना है। अगर पेशेंट एस मेडिसिन ले रही है तो उसकी डोज को हमें लगता है कि उसी डोज के साथ स्टेबल करके थोड़ा सा आयुर्वेदिक मेडिसिन को ऐड कर देना चाहिए।
हाँ
अगर
वही।
पेशेंट नहीं नहीं ले रही है और हमें लग रहा है थोड़ा डिस्टर्बेंस आ रहा है तो हम उसको एडजस्ट कर देते हैं। मतलब अगर डिस्टर्बेंस आ रहा है तो फिर हम उसको आयुर्वेदिक मेडिसिन पे थोड़ा सा एडजस्ट करके पहले देखते हैं। समटाइम्स क्या होता है कि फर्स्ट टाइमिस्टर में पेशेंट अगर ठीक से मेडिसिन ले लेता है या खान पान पे थोड़ा सा उस पर कंसंट्रेट कर लेता है तो थायराइड की प्रॉब्लम सॉल्व हो जाती है। घबराहट में नहीं कि नहीं इसका हमें इस बार आया, तो हमें उसको अगर हमें लगता है कि उसको T3 T4 T6 लेवल में कुछ वेरिएशन हमें अगर मिल रहा है तो हमें हमें लगता है 15 दिन के लिए आयुर्वेदिक मेडिसिन देके बच्चा पुनर्नवा इस तरह से मेडिसिन हम उसको देते हैं। थोड़ा सा काली मिर्च का पाउडर हल्का मात्रा में दे सकते हैं, और या फिर जैसे
गूगल कल्प भी
मालपुआ में
यूज करेंगे हम लोग इसमें, त्रिफला गूगल या कंचनार गूगल।
फर्स्ट टाइम में मैडम प्रेगनेंसी में अवॉइड करते
हाँ
हैं हम लोग।
गूगल
थोड़ा
तो
सा
नहीं देना।
बच्चा का इफेक्ट जी, बच्चा का इफेक्ट है, पुनर्नवा का इफेक्ट है। थोड़ा सा प्याज के रस का भी इफेक्ट माना गया है, जंगली प्याज का रस या जो हम लोग प्याज खाते हैं उसका रस ना, तो मतलब वो भी मात्रावत देना है, यानी कि एक्सेसिव नहीं देना है। बच्चा पुनर्नवा का अच्छा रोल है तो इसलिए बच्चा भी हेल्प करती है, मैदे रख दी है। और जनरली ऐसे ऐसे में हमको थोड़ा सा ब्राह्मी वगैरह भी ऐड करना रहता है। और उसके बाद सिम्टम वाइज थोड़ा ट्रीटमेंट दे सकते हैं। काकल रक्षक बटी एक बहुत अच्छी मेडिसिन आती है दूध का प्रेशर की,
कौन
वैद्य
सी,
रत्नम की
काकगायन
थायरो
बटी?
का। नहीं नहीं मैडम, काकल काकल रक्षक थायराइड को बोलते हैं ना, काकल काकल जो है वो थायराइड ग्लैंड का नाम है, तो
हाँ
काकल रक्षक बटी, तो काकल
ठीक।
ग्रंथि बोलते हैं थायराइड ग्लैंड को, तो उसकी काकल रक्षक बटी करके बीपी दूध का प्रेशर बनाते हैं। तो वो ड्रग बहुत अच्छी है, यूजफुल है। तो इस तरह से हम लोग उसको उपयोग में लाते हैं। तो हम देखते हैं कि उसका जो बहुत अगर माइनर लेवल है या एक मतलब मॉडरेट लेवल तक हम लोग हार्मोन्स को जो है वो नहीं देना चाहते हैं। जो हमें लगता है कि नहीं कंडीशंस अगर ज्यादा हो रहा है या इसको हम ऐसे नहीं मैनेज कर पाते हैं, तभी हम थायरोनान वगैरह लेते हैं। फिर वो उसके लिए फिर हम चाहते हैं कि एक बार एंडोक्राइनोलॉजिस्ट की एक बार जो है हमें ओपिनियन ले लेना चाहिए, उसके बाद ही प्रेगनेंसी में हमें स्टार्ट करना चाहिए जी।
बिल्कुल बिल्कुल बिल्कुल। मैम आई ने अभी उन्होंने कुछ डिटेल्स भी नहीं डाले, सिर्फ इतना डाला है, शायद वो पूछना चाहती है कि कैसे विचार करें हाइपरथायरॉयडिज्म में या हाइपो में। आयुर्वेद परिप्रेक्ष्य में मुझे लगता है इसमें कफदोष की दृष्टि है, और
जी
धातु में देखेंगे तो रस है, धातु रिलेटेड में तो धातु भी है, तो उससे ही ये संप्राप्ति बनती है। यानी कि कफदोष जो भी धातुओं से जुड़ा है, जैसे रस से है, मांस से है, मेद से है, शुक्र से है, तो इसीलिए फिर थायराइड में हम लोग देखते हैं कि जो भी सारे सिम्टम्स है वो रस धातु मतलब आर्तो दृष्टि से लेकर कभी कभी इनफर्टिलिटी तक या प्रेगनेंसी इंड्यूस्ड प्रॉब्लम्स तक ये जाते हैं। तो इस प्रकार से हम लोग इसमें सोच सकते हैं कि आयुर्वेद के परिप्रेक्ष्य में भी हम इसमें दोष धातुओं को कैसे देखेंगे। तो हाइपो या हाइपरथायरॉयडिज्म जो है, स्त्रियों में ज्यादा से ज्यादा थायराइड रिलेटेड विकार होने की संभावना होती है। मतलब देखेंगे तो एट द एज ऑफ मेनोपॉज या सभी ग्लैंड्स में थायराइड ग्लैंड का क्लोज कनेक्शन रहा है स्त्री के जीवन में। और बहुत ही जल्दी से कोई भी स्ट्रेस टेंशन है तो हार्मोन्स में बदलाव आता है, तो सबसे इसका पहला असर तो और लेवल पर ही पड़ता है। ऐसा एक अनुभव भी है, हम लोग देखते भी है। तो यहाँ पर जैसे अभी मैडम बता रही, तो मुझे लगता है मैम शोधन भी करेंगे हम लोग इसमें।
एक्चुअली मैडम प्रेगनेंसी में हम लोग मृदु
नहीं
शोधन
नहीं,
से ही पेशेंट को रख सकते हैं जी।
प्रेगनेंसी में तो मृदु
हाँ
करेंगे, बट अगर रेगुलर वाला
हाँ
पेशेंट है तो हम लोग शोधन करेंगे ना।
हाँ 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 हाँ, वो तो फिर धीरे धीरे अगर हमने ध्यान नहीं दिया तो रस धातु रक्त धातु के बाद वो मेदो धातु तक वो मेदो धातु की दृष्टि हो जाती है ना।
हाँ हाँ वही वही।
हाँ, तो जब मेदो धातु की दृष्टि हो रही है तो हमें उससे पहले ही वो वहां तक ना जाए या संप्राप्ति जो है वो बहुत अधिक विषम ना हो, तो सम संप्राप्ति पे ही चिकित्सा करना श्रेष्ठ कर रहता है। तो
हम्म।
हम लोग को जितना जल्दी संप्राप्ति विघटन हम लोग कर लेंगे उतना हम लोग अच्छा रहेगा। तो इसीलिए हमको रस धातु रक्त धातु पे ही जो है रसपाचक रक्तपाचक दीपन पाचन, ठीक है मैम। और बाकी जो कुछ फार्मूले हैं तो उसको यूज करते हैं, जैसे सभी बताते हैं जमन अग्निसर का भी फार्मूला है, बटर पनगवा एरन, और उसके साथ में जनरली जो है वो प्याज, जंगली प्याज के उसके साथ में, है ना। या इसके
हाँ,
अलावा भी हम लोग काचनार गुलगुल है, मेदोहर
कांचनार
गुलगुल,
गुगुल दे सकते हैं। हाँ,
गुलगुल है, अमृता गुलगुल है, काफी फार्मूले इसमें अकॉर्डिंगली, प्रश्न के अकॉर्डिंगली हम लोग यूज कर सकते हैं जी।
अच्छा अच्छा। आप में से किसी को कुछ बताना है? अंजू, डॉक्टर अंजू, केस के बारे में? डॉक्टर आदिति?
नहीं मैम, मुझे तो नहीं है इसका कुछ एक्सपीरियंस।
अच्छा, नहीं नहीं, आपका कुछ केस है तो बताइए कि आपने कभी देखा है ऐसे पेशेंट्स को।
नहीं मैम, ऐसे तो नहीं।
डॉक्टर स्वाति? डॉक्टर विमल मैडम का भी कुछ केस था, उन्होंने कुछ डाला नहीं है, वो शायद आए, इसीलिए मैंने एक्चुअली ये थोड़ा सा पहले जुड़ने को कहा कि हम लोग चर्चा करेंगे उनके केसेस को लेकर। फिर
मैम
6:30 बजे।
मेरा
हाँ,
एक और केस था, बट मेरे पास मैंने एक रूबेला पॉजिटिव वाले पेशेंट का केस डिस्कस किया था ना, जिसके 10-12 अबॉर्ट हो चुके हैं अभी तक।
अच्छा अच्छा। हाँ
उसने एक्चुअली, वैसे तो कल आना है उसने मेरे पास, उसको ना प्रेगनेंसी पॉजिटिव हो गई है।
अच्छा। हाँ, वो
जैसे
पिछले बहुत 1 महीने पहले किया था ना आपने, वो सब
हाँ
कुछ
जी,
कुछ
हाँ
था।
जी, हाँ जी मैम।
हाँ,
अभी तो उसका मैंने वो शोधन वगैरह चलना था, बट उसको फिर प्रेगनेंसी ही होगी थोड़े दिनों बाद ना, उसकी पॉजिटिव आ गई है।
अच्छा।
अभी वैसे कल आएगी, बट मैं वही सोच रही थी, अगर उसका फिर से ऐसे ना हो, उसके लिए, उसकी प्रेगनेंसी को सस्टेन करने के लिए हम आयुर्वेद में क्या कुछ दे सकते हैं?
बहुत है ना मैम। आप फलग्रुत वगैरह यूज किया था कि आपने अभी शोधन के समय पे या
नहीं
नशे के
मैम,
समय पे?
अभी नहीं शुरू किया था। अब उसको प्रेगनेंसी होगी ना उसके बाद, जब वो मेरे पास
अच्छा,
आई थी उसके हफ्ते बाद ही उसका, मतलब आज मुझे फोन आया था, वो कल आएगी वो मेरे पास, तो उसकी डिटेल मैं सारी
अभी
लूंगी।
कितना, मतलब कितने दिन हो गए प्रेगनेंसी कंफर्म होकर?
1.5 मंथ हो गया है।
अच्छा मैम, हम लोग सोमग्रुत एडवाइस करें, कहीं कल मैंने पढ़ाया था भेषज रत्नावली से, सोमग्रुत है बहुत अच्छा। बताया है कि 2 से 8 महीने, मतलब पूरा अगले 6 महीने इसको लेना है, बहुत अच्छा है गर्भपालक के लिए। और फिर बच्चा शुद्धोदर होता है, इसमें सभी कंटेंट्स भी जो दिए हैं ना, जीवनीय गण के ही कंटेंट्स है। और खासकर ये बनाया गया है कि इसका नाम ही सोम है, तो ये सस्टेन करने के लिए, प्रेगनेंसी को सस्टेन करने के लिए बहुत अच्छा रिजल्ट बताया है। वैसे हम लोग फलग्रुत का भी इस्तेमाल कर सकते हैं, गर्भपाल रस है, गर्भ विनोद रस है, काफी सारे कल्प हमारे पास है। बट जो कि मैंने कल पढ़ा तो मुझे ऐसे लगा कि ये भी हम लोग ट्राई करें क्या, सोमग्रुत। और ये बताइए मैम अंजू की ये कौन सी कितनी मतलब प्रेगनेंसी उनकी फर्स्ट है या?
नहीं नहीं मैम, उसका मैंने बताया था ना उसको, उसके 10 साल हो गए हैं उसकी मैरिज को, उसके बाद उसका रूबेला पॉजिटिव आ गया था,
अच्छा,
फिर उसने
फर्स्ट ही है,
वैक्सीनेशन।
मतलब फर्स्ट ही है। और अबॉर्शंस कितने हुए हैं?
हाँ, 8-9 तो हो चुके हैं उसके।
अरे
अब बार तो वही फर्स्ट ट्राइमेस्टर भी कंप्लीट नहीं उसका कभी भी पूरा हुआ। मैं बता रही थी ना पिछली बार की, उसकी
हाँ
ड्यूरेशन
हाँ।
कम हो रही है, कम कम हो गई है अभी। 1 मंथ एंड 5 डेज तक की रह गई थी उसकी जो वायबिलिटी ना। पहले
वायबिलिटी।
जैसे 3 मंथ्स पे अबॉर्ट होता था, फिर धीरे धीरे कम होती गई उसकी वायबिलिटी, फीटस की ना, डेज
अभी
जो कम होते
अभी
गए।
लास्ट वाला कब हुआ था अबॉर्शन? मार्च में बताया था ना आपने?
हाँ, फेब में बताया था मैम।
हाँ, फेब में, यस यस यस।
जी मैम।
ठीक है, अभी तो ठीक है, 6 महीने तो हो चुके, थोड़ा गैप देने को बताया था ना आपको। हाँ, फिर भी
हाँ
अभी
जी।
वो कंसीव हो गई ना शायद। अच्छा, ठीक
मैं
है।
उसमें अभी अभी वो कल आएगी, तो फिर मैं उसको क्या ऐड कर सकती हूँ उसमें? इसमें जो मासानुमासिक टैबलेट्स जो आती हैं हमारी, वो कुछ उसमें कुछ ऐड कर सकती हूँ मैं?
हाँ हाँ, वही मुझे तो लगता है कि फलग्रुप भी चालू रखेंगे,
हाँ,
स्टार्ट
घृत
करेंगे, या
घृत तो चाहिए ही, क्योंकि
पुष्पान
उसके
तो चाहिए,
यूट्रस
स्नेहन
को।
चाहिए
हाँ जी।
उसको थोड़ा सा, क्योंकि धातु का बल बढ़ाना है। तो
जी
आहार
मैम।
विहार का भी थोड़ा सा बता दीजिएगा, मतलब लाइक सस्टेन के जैसे हम लोग इसमें खजूरवटी वगैरह भी दे सकते हैं, थोड़ा पौष्टिक भी रहेगी। मैम हम सोम ग्रुप ट्राई करेंगे क्या इसमें? अंजना मैम, आपका क्या विचार है?
जी जी मैम, कर सकते हैं। समुद्र तो आप बताए हो, समुद्र तो अपने आप में बहुत सुपर है।
हाँ,
और इसके
सुपर है
साथ
बहुत।
में जो है, एक अगर हम इसमें स्वर्ण योग भी दे देंगे तो अच्छा रहेगा, स्वर्ण मार्गी। क्योंकि
अच्छा।
जनरली, हाँ, जनरली ऐसे पेशेंट में जो है BOH या ऑब्स्टेट्रिक हिस्ट्री की प्रॉब्लम रहती है। तो हमें दे देना चाहिए। और अगर पता नहीं रूबेला वैक्सीन लगवा पाई मैडम की नहीं, रूबेला वैक्सीन का भी एक प्रोटोकॉल होता है, उसको
मैम
भी
वो
हम लोग
लगवा
जो
ली
है
थी, उन्होंने लगवा ली थी, उसी टाइम ही लगवा ली थी जब उनको फर्स्ट टाइम पता चला था, बट उसके बाद उन्होंने कभी टॉर्च टेस्ट नहीं करवाया था।
अवरक भस्म वगैरह, शतपुटी अवरक भस्म वगैरह का भी यहाँ पे कुछ अच्छा इफेक्ट मिलेगा मैडम?
मैम उसकी स्वर्ण वसंत मालती की डोज क्या रहेगी? 250 mg पर बीडी।
कितने दिन तक देते रहेंगे मैडम स्वर्णमालिनी वसंत?
शायद
3 महीने। 3 महीने तक तो देते रहेंगे अब हम। यस मैम। शायद मैडम का कनेक्शन चला गया।
कनेक्शन चला गया।
हाँ। और बाकी क्या एज क्या बताइए मैम एक बार?
मैम एज उसकी हो गई है 34-35।
अच्छा। और काम क्या है उनका?
टीचर है मैम वो।
अच्छा।
अभी मैं यही सोच रही थी कि कुछ स्वर्ण योग, बट उसका मुझे थोड़ा डोज का, जैसे स्वर्ण वसंत मालती की 250 mg बीडी डोज होगी मैम।
250 mg, हाँ बीडी, हाँ।
बीडी ये एक पाउडर फॉर्म में भी आता है और टेबलेट फॉर्म में भी आता है।
हाँ, टैबलेट में ही दीजिए, मुझे लगता है ज्यादा बेहतर रहेगा।
हाँ वो
अभी
थोड़ा।
स्टार्ट कीजिए उनको, 1 महीना दीजिए। मुझे लगता है कि अभी इस बार आपने शोधन कराने के बाद प्रेगनेंसी कंफर्म हो गई ना? आपने क्या क्या ट्रीटमेंट दिया था, पूरा कर
नहीं
लिया
मैम,
था अपना?
नहीं मैम, अभी मैंने ट्रीटमेंट नहीं दिया था उनको। वो
हाँ।
उनको मतलब जब वो मेरे पास आई थी उसके थोड़े दिन, 2-4 दिन बाद ही उनकी जो है प्रेगनेंसी पॉजिटिव आ गई थी। तो फिर
अच्छा।
आज उनका फोन आया था मुझे, वो कल आएंगे मेरे पास। तो मैं सोच रही थी कुछ इसमें उसकी मतलब उसकी प्रेगनेंसी को सस्टेन करने के लिए कुछ आयुर्वेद का मैं क्या कुछ ऐड कर सकती हूँ,
हाँ,
ताकि
वो भी
उसका दोबारा।
वो ये भी ऐड कीजिए, उसको थोड़ा काउंसलिंग भी कीजिए, स्ट्रेस ना ले, थोड़ा पॉजिटिव सोचे। या फिर कुछ संबंध भी प्रस्तापित ना करे। अभी एक बार प्रेगनेंसी हो गई है तो सस्टेन होने दे, थोड़ा वो भी एक बताइए उनको। मुझे लगता है वो भी थोड़ा बताना कभी कभी जरूरी रहता है। और फिर ये हम लोग स्टार्ट कर देंगे इसको, अच्छा है रहेगा। सोमरूत आता है, सोम कल्याण घृत से मिलता है बाजार में, मार्केट में।
जी मैम।
हाँ, और बहुत अच्छे उसके ये है, तो वो भी दे
ये
सकते
कब,
हैं।
हाँ कितना टाइम तक दे सकते हैं मैम ये?
इसको बंद ही नहीं करना है बताया है, मतलब 6 महीने
एंटायर
कंटिन्यू दिया है। 6 महीने कंटिन्यू
6 मंथ
पूरा।
तक?
हाँ पूरा इसको ऐसे, मतलब। और डोज भी कम है इसका, आधा चम्मच ही डोज है। और गोदुग्ध के साथ दीजिए बताया, गोदुग्ध के साथ देंगे तो और सस्टेन होने में भी मतलब मदद में मिलेगी। बल भी बढ़ेगा, धातु का बल भी बढ़ेगा, ऐसे गर्भाशय का भी कौन मतलब बल भी अच्छा रहेगा इससे।
जी
वैसे
मैम।
बहुत सारे कल्प है, बट अभी पता नहीं उसकी प्रकृति वगैरह कौन सी लगती है आपको? वातज है प्रकृति?
अ, हाँ जी मैम, बात बात कफ
बाकी पेट
जैस।
वगैरह तो साफ होता है, उसके लिए भी वो ज्यादा कुछ प्रवाहन वगैरह कुछ नहीं है ना उसमें, हेतु वो टाइप की।
नहीं अभी जब वो पिछली बार आई थी तब तो नहीं, उसने ऐसा कुछ नहीं था।
अच्छा अच्छा। ओके ओके। वो ये 2-3 बातें ये कर लेंगे हम लोग, इससे स्टार्ट करेंगे। अभी और दूसरा कुछ उन्होंने टेस्ट कराए हैं?
मैम अभी उसने कुछ नहीं करवाया, अभी बस थोड़ी
बस
सी फोन पे
प्रेगनेंसी।
बात। वो कल आएगी तो फिर मैं उसकी डिटेल में सारी लूंगी, क्या क्या उसने एट प्रेजेंट क्या चल रहा है उसका।
अच्छा अच्छा।
इनमें मैम मैं मासानुमासिक टेबलेट कर सकती हूँ ना शुरू उसकी?
हाँ करिए ना, करिए ना, करिए करिए।
कौन
मासानुमासिक वाली भी करिए,
मैम कौन
मासानुमासिक करिए।
कौन सी कंपनी की अच्छी आती है ये, कुछ ऐसे कुछ?
वैद्यनाथ की तो अच्छी चलती है मेरे हिसाब से बहुत। दूध पापेश्वर की भी आती है ना।
ओके जी।
वैद्यनाथ की दे दीजिए फिर।
ठीक है मैम।
हाँ।
ठीक है मैम।
और ये भी अभी सुवर्ण मालिनी वसंत भी स्टार्ट कर दीजिए।
जी मैम, ठीक है।
ये 2 तो स्टार्ट कीजिए, ज्यादा मेडिकेशन भी नहीं देंगे हम लोग।
हाँ जी मैम, ज्यादा तो नहीं अभी उसका।
हाँ, ज्यादा तो नहीं देना चाहिए, तो इतने से मुझे लगता है कि थोड़ा सा वेट एंड वॉच करेंगे, काउंसलिंग करना, बाकी ये तो ठीक है।
जी
और
मैम।
किसी का है कुछ? डॉक्टर रंजीत, डॉक्टर अदिति।
हेलो।
हाँ, यस मैम।
हाँ नमस्ते मैम, अदिति।
या
नमस्ते
यस
अंजना मैम।
अंजना मैम, शायद उनका इंटरनेट इश्यू है, बताइए।
मैम मेरा एक केस है, अभी वो आई है मेरे पास। अभी मैंने अभी ट्रीटमेंट स्टार्ट नहीं किया है, बस मुझे एक मैम डायरेक्शन चाहिए था कि कैसे जाना है मैम। एक्चुअली मैम वो ए निगेटिव उसका ब्लड ब्लड ग्रुप है। और मैम उसकी शादी को 3 साल हो चुके हैं, और मैम 2 एबॉर्शन हुआ है। तो एक हेलो।
हाँ, सुन रही, मैं सुन रही, बताइए।
हाँ, तो मैम जो पहला अबॉर्शन हुआ था वो उसका 15 डेज में हुआ था। तो वो बोली कि तब तक उसे कुछ ऐसा लगा नहीं, लेकिन 15 डेज में अबॉर्शन हो गया था। अब वो ओवरड्यू पीरियड था या वो प्रेग्नेंट थी, इसका कोई श्योरिटी नहीं है मैम। फिर वो दोबारा प्रेग्नेंट हुई थी मैम। तो उसका जो पीओजी था मैम, मतलब मेंस्ट्रुअल एज था 10 वीक्स, लेकिन जब यूएसजी कराई थी तो उसका 5 वीक्स आया था मैम। फिर मैम वो छठे वीक में उसका एबॉर्शन हो गया मैम। और मैम जो रुबेला है वो बॉर्डर लाइन पॉजिटिव है, मतलब 1 है, तो वो बॉर्डर लाइन में ही आता है मैम। तो इसको मैं कैसे लेके चलूं मैम? मैं एक तो मैम वो निगेटिव ब्लड ग्रुप है और हस्बैंड का पॉजिटिव है। अब मैम 6 वीक नहीं हुआ था तो हम एंटीडी वाला तो
आपने ये दिया उनको कुछ मतलब एंटी-डी का इंजेक्शन देना होता है ना, वो
नहीं।
कुछ?
नहीं
हाँ
मैम, कुछ भी मैम, ये मेरे पास अभी आई, ये सब उसका पहले
हाँ
हो चुका है। उसको एंटीडी का इंजेक्शन अभी तक लगा नहीं है मैम।
हाँ, देना चाहिए, देना चाहिए, क्योंकि अभी देखिए फर्स्ट प्रेगनेंसी में तो ज्यादा उसका ये नहीं बढ़ता है, बट सेकंड लेटर ऑन प्रेगनेंसीज में इसका परसेंटेज बढ़ जाता है ये।
लेकिन मैम एंटीडी तो तब देना चाहिए ना जब वो 6 वीक से ज्यादा होता है। इन
6 वीक
दोनों ही
से ज्यादा
केसेस में
एज अ प्रिवेंटिव मेजर पर भी दे सकते हैं ना, आफ्टर
तो
डिलीवरी
मैम
भी दे सकते हैं, या फिर प्रेगनेंसी के दौरान भी देंगे हम लोग उसको। 2 बताया ना उसको, 2 टाइम दे सकते हैं हम लोग।
हाँ मैम, एक 24 वीक्स में जाता है
हाँ,
और शायद 30s में जाता है मैम।
30,
लेकिन
हाँ
मैम
30, हाँ।
लेकिन मैम मैं ये बोल रही हूँ कि जैसे ये तो 6 वीक तक तो आई नहीं, तो अब मैं क्या करूँ मैम? मैं इसको क्या एंटीडी देने के बाद इसका ट्रीटमेंट स्टार्ट करूँ, या मतलब मैं क्या करूँ?
नहीं, अभी प्रेगनेंसी नहीं है ना उनको? अभी
नहीं
कितना?
मैम, अभी नहीं।
अभी से मतलब सेकेंड वाला एबॉर्शन कब हुआ था?
मैम मार्च में हुआ था।
मार्च में हुआ था। अभी आपको उनको कंसीव मतलब इसके लिए भी ट्रीटमेंट देना है पूरा?
हाँ मैम, हाँ मतलब वो मेरे पास इसीलिए आई है मैम।
अब ये बताइए कि उनकी एज और उनका प्रोफेशन, मतलब व्यवसाय क्या करते
मैम वो
हैं?
हाउसवाइफ है,
और
24
जो
इयर्स
दोनों
एज है।
एबॉर्शंस हुए थे, तो वो रुबेला बॉर्डरलाइन पॉजिटिव था तभी भी था? कब
नहीं
किया
मैम,
ये?
ये तो टॉर्च वाला मैम एबॉर्शन के बाद डॉक्टर्स ने कराया था उनका।
ओके ओके ओके, ठीक है। हम लोग इसके ऊपर भी चर्चा करते हैं। हमारे साथ हमारे आज के स्पीकर मैडम भी है, डॉक्टर पद्मा मैम, नमस्कार, गुड इवनिंग।
हेलो मैम, गुड इवनिंग।
गुड इवनिंग, यस। आपके पास बाजू में फोन वगैरह है क्या? कुछ मोबाइल और लैपटॉप दोनों साथ में है क्या जूम पर? तो आवाज आ रही, इको हो रहा है, इको हो रहा है थोड़ा सा,
That is what I'll mute my
लिटिल इको।
laptop one. Okay. Is it clear now?
नहीं नहीं, आ रहा है मैम इको।
One second.
शायद मतलब मोबाइल भी है ना साथ में, तो आप लैपटॉप है तो लैपटॉप से ही जूम ज्वाइन कीजिए, और मोबाइल से फेसबुक देखिए।
Yeah.
आर यू देयर मैम?
Yes, ma'am. Now I disconnected it from phone.
Yeah, okay. So
Thank
I
you.
will make you this name Pratap. Okay.
Yeah, yeah.
So आदिति,
हाँ
हम
जी मैम।
मैम को ही पूछेंगे ये केस, आप जुड़े रहिए। मतलब अभी
जी मैम।
प्रेगनेंसी रिलेटेड ही है ना हमारा सेशन, तो वी विल डिस्कस। इट्स
ठीक है
बेटर
मैम।
टू डिस्कस विथ मैम आल्सो। ओके,
ठीक है मैम जी।
या
तो मैं मतलब shall I start now or after the ma'am program or lecture?
हाँ, मैम का होने के बाद ही।
ठीक है मैम।
जस्ट 2 मिनट में हम लोग स्टार्ट कर दे डॉक्टर पद्मा, इज इट ओके?
Let the participants join, ma'am.
हाँ, yes.
Yeah, we'll wait for some time because only 5-6 members, I think. No.
हाँ, yes, डेफिनेटली वी विल वेट फॉर सम टाइम। तब तक हम लोग ये केस डिस्कस करेंगे डॉक्टर पद्मा मैम।
Sure.
या तो अदिति, अभी आप सुन रही थी ना मैम, शायद उनको
हाँ जी,
कि
हाँ जी।
हाँ, तो 2
अच्छा,
अबॉर्शंस हो चुके हैं ऑलरेडी एंड शी इज लाइक माइल्ड रूबेला पॉजिटिव। तो अब कैसे विचार करें हम लोग, अभी कैसे मतलब प्रेगनेंसी के लिए क्या करें?
1 second, ma'am. 1 second.
Yes.
Actually, I was opening my PPT. I'll just.
या ओके।
You can hear me, no?
या
Yeah. Can you tell me about the case completely? I didn't hear last time.
डॉक्टर अदिति प्लीज कंटिन्यू।
हाँ जी मैम, हाँ जी मैम। मैम, there is a patient 24 years old and ma'am obstetrical history like ma'am she had 2 abortions, married life
Okay.
for
2
5
abortions
years.
at how many weeks?
Sorry, हाँ मैम, I'm telling you मैम, one was abortion मैम। वो एक abortion था कि नहीं था वो श्योर नहीं है, पर ये था कि 15 days overdue menses हुआ था, उसको bleeding हो जाती है मैम। दूसरा वाला मैम मिस्ड abortion था और
Diagnosed
ये था
pregnancy after 15 days she had bleeding, means it was diagnosed, UPT was positive.
ma'am, no, she was not sure about it because she didn't go for UPT. But she was telling me कि शायद वो था लेकिन ऐसा bleeding हो गया, तो I'm not very sure about that one. But ma'am, this one which happened in March 2021, it was around 6 week ma'am। 16 Feb का मेरे पास USG है, तो मैम उस टाइम उसका एज था मैम 5 weeks 5 days, और मैम फिर मार्च में उसका अबॉर्शन हो जाता है, मतलब दैट मस्ट हैव क्रॉस्ड मैम 6 weeks। अब मैम जो पेशेंट है वो ए नेगेटिव है मैम, और जो उसका हस्बैंड है मैम वो पॉजिटिव है, RH पॉजिटिव है।
Okay.
और मैम जो रुबेला है दैट इज बॉर्डर लाइन पॉजिटिव। आई जस्ट वांटेड टू नो हाउ शुड आई कंटिन्यू माय ट्रीटमेंट मैम। अभी वो आई है मेरे पास।
When was that rubella test done? Whether it is during pregnancy or prior to pregnancy?
मैम it was after the abortion.
After the abortion. Whether it was IgG positive or IgM?
Ma'am, it was cytomegalovirus IgG. It was borderline.
IgG is a chronic infection. It doesn't cause any harm to the pregnancy once the patient is immunized. Okay. So IgM is an active infection which can cause. But once the IgG is positive, means she has already been immune to the particular virus. It doesn't cause much problems.
Okay,
Only
ma'am.
in case of active infection, the virology will reach the baby and then it can cause some teratological effects. If it is a chronic one, we can easily treat with our medications just to support. But IgG is not an active infection. It doesn't cause abortions. And one more thing you mentioned is an A negative
Yes, ma'am.
blood group. So A negative blood group means we have to see whether there was whether she has taken anti-D prior when she got the doubt of abortion in previous thing. You gave a history even without the UPT positive. She got pregnancy and then clots was passed where she considered it as first abortion. No. So that is again depends upon the strength of the isoimmunization. She should have been given even after abortion. If she has undergone DNC, she should be given Rogam 300 mg. That is anti-D should be given so that there will not be any problems in the baby in the next pregnancy. Okay, so next she can conceive with 1 Panchakarma. You can give her 1 Virechana along with Yogavasti and Uttaravasti, and you can keep her on Phalasarpis and Torchnil capsules. This has given us very good results.
Torchnil capsule.
Yes. From Pilapi Labs, there is a Torchnil capsule. Even with the chronic infection, even though it doesn't cause much problem to the baby, but still we consider there is infection. Because immunocompromised state of the pregnancy, if it becomes active during pregnancy, I think there will be a problem. So we will,
Ma'am, should we go for anti-D injection? Should I suggest her for anti-D injection? Because she didn't went for it.
Then you can give it to her now.
Okay, ma'am. After anti-day injection, I should go for Panchkarm. Means Virachan and
Yeah, but usually the antibodies already would have developed if she has not taken in previous pregnancy. When she is planning to go for pregnancy, you can go for direct Coombs test, and you can
okay,
see
ma'am.
positive or not. So when you do Coombs test, no, if it is positive, then there is antibodies. So you have to give anti-D. If there is no antibodies, if it is negative, she can directly go for pregnancy.
Okay, ma'am. Okay, ma'am. Thank you. Yes, ma'am.
Yeah. So I think we should start, Dr. Padma. Is it okay to start?
Yeah, ma'am. Yeah.
Yeah. So will you please open your video?
Yeah, 1 second, I'll on because I was just checking with the video.
Yeah. No issue.
Actually, I'm not very much
Okay. No issue.
with this phone. I have given many presentation. I think light is a problem here. I'll just change my. Is it? Am I visible?
Yeah, you are visible. Just light is little low light is there.
1 second.
But it's okay. I think during presentation you can hide your camera also. No issue. If there is no place, मतलब अच्छी जगह नहीं मिल पा रही तो it's okay. No issue.
Not like that. Actually, I wanted to shift to my room. Suddenly, you called me, so I sat here in hall. And you will be hearing some disturbances from my son as it is Sunday.
Okay.
So that's why I thought of.
Okay.
I changed my position.
But it's okay, ma'am. Now it's okay. Yeah. Now it's okay. You are visible. Yeah, it's okay.
I'll share my screen.
Yeah, just wait. I will introduce your biodata. Okay. So, नमस्कार, गुड इवनिंग टू ऑल। आज के इस सत्र में आप सभी का स्वागत है। जैसा कि हम लोग इस गायनिक लेक्चर सीरीज को चला रहे हैं और ये अबाउट हमारा 13th लेक्चर है इस गायनिक सीरीज का। सो आई वेलकम डॉक्टर पद्म सरिता। मैडम इज कंसल्टेंट इन आयुर्वेदा गायनोकोलॉजिस्ट इन FRLST यलंकावा, प्रोफेसर PTSR श्री परिपूर्णिमा संताना धर्म आयुर्वेदा मेडिकल कॉलेज एंड हॉस्पिटल रिसर्च सेंटर. She is running also her own clinic, that is Dhatri Healthcare. So I welcome Madam on this platform of Ayush Darpan, and Madam is dealing with all these gynecological issues since last 10 years. She has experience in conducting the normal delivery, LSCS, and other gynecological operations. Experienced in treating PCOD, infertility, and gynec diseases, and so did YSC and guide yoga for all the OBG cases. And I really welcome Madam on this platform, and we are really pleased to hear you. The today's topic is pregnancy problems and Ayurveda solutions. I think it must be a very much सबको बहुत ही दिनों से इस टॉपिक का इंतजार था. So I welcome मैम. प्रेगनेंसी प्रॉब्लम्स और आयुर्वेदा सॉल्यूशंस, जो भी माइनर प्रॉब्लम्स होते हैं इसमें आयुर्वेदा का व्यू कैसे होना चाहिए, इसके बारे में डॉक्टर पद्म सरिता मैडम यहाँ पर हमारे साथ है. तो आई वेलकम मैम, यू कैन स्टार्ट योर प्रेजेंटेशन.
Ma'am, thank you so much. And I'll be dealing whichever problems I have seen in my practice very often. So if I'm not covering any other topics, you can directly. Okay.
Yeah.
Yeah.
At the land, we will discuss question and answer sessions also.
I will be discussing more oftenly whatever was coming from my patients, and on my experience, I'll be dealing some important topics because 40 minutes is a time given to me.
No, ma'am, we can continue. We have time up to 8, but with the discussion, no issue. You can take a time.
Okay, no problem. I'll finish off whatever I thought of presenting, and later you can ask the doubts. Okay.
Yeah.
Even I am in front of you all in Ayush Darpan. Thanks for welcoming me for this wonderful session. Yeah. So pregnancy. There is a.
Yes, ma'am, it's visible.
Yeah. So pregnancy, you know that nowadays it is one of the important phase of every female's life. because of late marriages and even postponing their first pregnancy because of their goals and settling down in their professional lives and keeping the higher goals. So many patients will come to me with so many queries, complaints, and management. That is what I'm here to discuss. So we all know that pregnancy is a critical period now in 21st century, and they will have all the knowledge before conception, unlike in olden days. Only after getting UPT positive, they will be learning about each and every month. But now it is a critical period, and every pregnancy, even though the conception itself has become challenging in, especially in urban areas like Bangalore. So many patients will be conceiving with difficulty. So critical care and every pregnancy is precious. So it is very important whenever they approach us, especially Ayurveda gynecologists. So it is not just in olden days, they will be giving food double. It is one for the baby and for the mother and extra nutrition and all. But nowadays, we even learn that the baby is not into the outer world. So the sense organs are not completely having its outside into the outer world. So it is the best time to give Garbha Samskara. Nowadays, many patients themselves will come for Garbha Samskara. So we can imbibe so many qualities and samskaras to the baby in utero itself. Hence, in Ayurveda, we say that it is not just for the pregnant lady, it is not just the physical strength. We also have to give her equally the mental and spiritual well-being, so that the baby which will be born with higher qualities, what we call as Shreyasi Praja. So queries will be in different directions. It can be in the form of diet, exercise, travel, and on marital relationships and bed rest and physiological changes in labor. So many patients will be non-vegetarian and they will be accustomed to spicy food, fast food. So they will be asking in pregnancy what changes they have to make. And we will be advising specially to the monthly paricharya. First month will be second month, third month. Like we will be giving them different paricharyas with a particular diet, which in turn will help in proper physiological changes in pregnancy. Okay, so we will be avoiding the Garbha Upagatakara Dhavya. You know that excessive Atitarpana, Atarpana, Tikshna Ushna Dhavyas are not indicated in pregnancy. So if these kind of diet is given, it can lead to abortion and other kinds of abnormalities. So diet particular to the patient, it can be tailored. And exercise. So many patients will be doing yoga and exercise. So some even will be doing advanced yoga, hatha yoga, and they will be into too much of strenuous exercise to lose weight and all. So in pregnancy, even though it is physiological, acharyas consider vyayama during pregnancy is not so good. So methodical pranayama, methodical yoga can be advised, which will especially in first trimester to improve the organogenesis, and in second trimester to provide the nourishment to the child and to enhance circulation to the fetus. And in last trimester, it is majorly to improve the strength of the pelvis and to aid in normal delivery so that there is more flexibility of the pelvic bones. And coming to the travel, and whoever is having the history of abortion, they will be repeatedly asking whether they can travel through the air, train, or through the bus, 100 kilometers, 200 kilometers. So whenever there is a history of abortion, we will be asking them not to travel till 12 weeks. And in olden days, it is given Yana, Vahana, Advagamana. So strenuous exercise, especially after second trimester, there will be postural difference, lumbar lordosis, all these things will be there. So in olden days, it was on animals. So the linear type of traveling wasn't there. So it was completely prohibited. But now after 12 weeks by train, we usually, if there is no abnormal history, even we can guide them in the second trimester. Coming to the marital relationships, many patients will be asking whether they can be sexually active. So in case in history of abortion and all, first 12 weeks, it is usually not indicated. So Vyavaya is again Garbha Upagatakara Bhava. The orgasm caused in sex can cause uterine contractions. In term, it can cause abortions. And in second trimester and third trimester, it can cause bleeding. And in last weeks of pregnancy, it can be even causing some infections because the vaginal pH will be lower And if the partner is infected, again there can be chances of infection and white discharge. And in very last weeks, when she is nearing or approaching labor, there can be even PROM, cord prolapse, which in turn she has to rush to the hospital for the delivery. So all these complications are there. So that also based on the patients we have to advise. In some patients, it is bed rest is required. Not in all kinds of patients, like in central placenta previa and huge bleeding in first trimester with fetal heart rate present in USG. And some patients will be having too much of fear about labor. So that has to be enhanced by giving proper charts, and demos should be shown to them how physiological the labor will be and how naturally it can happen without any fear, and how the pelvic bones open themselves and the ligaments will not interfere even though the baby is around 3 kgs. So that fear has to be gone, because so many patients with fear, there will not be proper oxytocin and there will not be proper relaxation. In turn, it can lead to obstructed labor. So keeping the high psych and positivity throughout the pregnancy has been given one of the main Samanya Paricharya by all the Acharyas. So the Samanya Paricharya we should never forget in all cases. So the basic is Garbhini Paricharya. If we are giving the proper Paricharya, they will not end up in complications. So before going for the ailments, we should always have the knowledge, the periodic checkup of the patients. That is, we know that monthly once till 55th month, and then 15 days once since 8th month, and in 9th month every week they have to visit the clinic when there is non-risky patients. And we have to ensure both maternal and fetal well-being, her weight gain, her BP, her sugar levels, and her blood checkup. And if any kind of pathologies like edema, vomiting, that should be detected early, and we have to take necessary actions. Coming to the examination, initially how the patient was appearing, and at the end of the pregnancy how she's appearing. So all the records has to be made: build, nourishment, height, weight, and moderate nourishment. In less nourishment patients, we can give extra nourishment either through Kshiropakas or Grita preparations. And there will be some patients who will be weighing around 37, 38, 40 kgs, and the height also will be less. They are called constitutionally small mothers. So when constitutionally small mothers are there, there are major chances that small for gestational age babies will be born around 2.2 kg, 2.3 kg. We cannot expect big babies from them, so we cannot treat that babies as IUGR and go for extensive treatment modalities. So that is also one of the point. And abdomen examination is one of the basic in all kinds of ANCs. So through abdominal examination, through proper identification of the fundal height only, we'll come to know the pregnancy, how many weeks it is, and how the baby is growing, and about the liker also, whether the parts are freely movable, or if there is oligohydramnias, or if there is polyhydramnias. Polyhydramnias may be there in cases of congenital abnormally baby, or even in gestational diabetes mellitus, and in other cases of infection. So all those has to be kept in mind. When we have the proper knowledge, then only we can identify the problem and can give better solution. So routine pregnancy investigations, we all know. So hemoglobin, and as just discussed, the Rh negative pregnancy should be identified early and should be given anti-D. And in cases of infections, HIV, HBs, AG, we can try stopping the vertical transmission of the infection from baby, from the mother to the baby. And BT-CT platelet count, and GTT, glucose tolerance test in obesity patients whose BMI is more than or equal to 30 in or around 28. So in such cases, previous history of IUDs and stillbirths. So GTT becomes main important in case of previous abnormal pregnancies. And urine, especially for albumin and infection. So excessive albumin present or protein present in urine gives us an idea of preeclampsia, which is again one of the main diagnoses. So considering the monthly development changes, we have to go for proper interrogation about her appetite, her bowel movement, her bladder, either white discharge or any other itching on the abdomen like striae, and expression of the breast milk. So many things will be there. So the routine interrogation should be done for her well-being. And inspection. however, palpation to know the position and how the fetus is doing, the fetal kick count and all. And auscultation is very, very important because fetal heart rate is one of the sign of life. So auscultation every time when the patient is coming, that is also important. And even the murmurs can be heard in physiological murmurs or pathological murmurs in patients. So even ausculting the heart is also very important. So antenatal fetal surveillance. So in the first few weeks of pregnancy, identification of cardiac activity around 6th to 7th week to transvaginal scan is important, and we do NT scan so that there is no trisomy present. And in second trimester, we in cases where there is previous history of abortions, repeated abortions, and if there is a consanguineous marriage and all, we will be going for chorionic villus sampling, amniocentesis, triple test from 15 to 18 weeks, serum alpha fetoprotein, HCG in cases of doubts of either it can be twin pregnancy or what we call tubal pregnancies. It can be done even in first trimester. And anomaly scan to know the complete anatomy of the fetus around 20 to 22 weeks. This is also very, very important. In third trimester, it is very important to know the biophysical profile. That is like the movements, tone of the fetus and fetal heart rate, all these becomes important. And even NST, non-stress test. So all these are the general guidelines to know in pregnancy. So coming to the subject proper, this is the topic of today. So the first and foremost complaint is nausea, vomiting and heartburn. It will be there throughout the pregnancies for some patients. It will be there up to 12 or 16 weeks in few patients. So even though it is physiological, if the patient is continuously vomiting, leading for weight loss and dehydration, and she is not able to cope up with pregnancy, that becomes pathological. So Kashyapa has given that there can be association of indigestion and Chardi along with the pregnancy, and even Chardi can exhibit itself as an independent disease even in pregnancy. But if it is because of HCG and hormonal thing, because there is increased progesterone levels, so there is stasis of the food and cardiac sphincter of the stomach will be relaxed. In such cases, the diet changes becomes very, very important. So we always have to advise her immediately after getting up from the bed. She should not go for brush. She should be given some dry carbohydrates, either in the form of carbohydrate biscuits, rusk, one or two, and then she should be given medications, whatever we are prescribing. And frequent small bland diet is very, very important because milk will be the main diet. So what Acharyas has given, because it is rich in and it is a complete food and it is having all the vitamins, fat, protein. So that is the best thing, even which will help in osmosis and proper organogenesis of the fetus. So milk, even in small quantities, will be very helpful for the patient. So it should be blanded. There should not be any spicy food. Here they have given like Ludu, Shishira, Snigdha Ahara should be given. So same thing can be followed, which will not initiate excessive vomiting. That is what we call. Emesis gravidarum is physiological, but it becomes pathological when it is too much of dehydration. So, and whatever the diet we give, because they are having too much of salivation and vomiting, so the drugs which are Deepaniya and Pachaniya and also relieve constipation, that has to be given. So those can be managed with the changes in the diet itself. And when there is too much of vomiting, then we have to go for medications. So in Ayurveda, they have given different kinds of fresh preparations like Bilva Majja Phala and Yava Sattu, Laja Sattu, which will provide instant energy. But nowadays, we cannot ask them to go for fresh preparations. So the common drugs what I use in my clinic is Madhiphala Rasayana and tab and syrup Vomitab are available from Charaka Pharmacy. Matulunga Rasayana. So all are Amla Dravya, Hridya Dravyas. So that will reduce the vomiting. Sudshekar Rasa, even though it is having rasa sugars, it hasn't given any abnormalities in the fetus. It has thoroughly decreased the vomiting in pregnancy. And the patients who are having too much of heartburn and burning sensation, so they will be given Kamadiga Rasa, either 1 or 2 daily. And Dadi Mavaleha, that is also 2 teaspoon BD, that also will improve the taste and it is helpful for the patients to relieve vomiting. and sometimes it causes constipation, so that has to be taken care. So next, coming to the pedal edema, even though it is physiological, so Padayoho Shvaitu is one of the symptoms of pregnancy, but Garbhini Shota. So every time you cannot say that it is physiological. So you should have all the knowledge that why it is not reducing in patients who is having excessive edema. So you will have to consider whenever patient is continuously on strenuous standing for longer hours and sitting for longer hours and working. So if it is developing in the evening hours and with the rest of 4 or 6 hours or nighttime rest after sleep, it should usually should reduce or completely disappear. That we call as physiological. So we should be having knowledge that she is not having anemia. So even there are other conditions and severe conditions and small conditions also, which can cause pedal edema. So those conditions like in twins, the intravenous return will not be proper because of too much of abdominal girth. And in varicose veins, hypertensive disorders, renal disorders, and cardiac disorders also, the patients will not respond better in these cases. So you have to consider if the edema is persisting even after the rest, you have to think of the pathology and then you have to go for proper investigation and diagnose the cause and then treat the cause. So whenever it is idiopathic or it is only because of pregnancy induced pedal edema, I usually go for Punarnava Mandura, Gokshura Kshirapaka. So as it is mentioned in 7th month Paricharya, Gokshura Siddhavrita, it is not available in any pharmacy. So Gokshura Churna is given and then in 250 ml of milk, diluted milk, they have to boil the powder and then on empty stomach, morning and night, they can have. That will also reduce the edema. And Cardorium Plus is one of the syrup that is also Hridya. It is having Arjuna, Mandura and other drugs, which are Hridya Dravyas that will even control the BP. If the patient is having 130, 80 and all. So even though it is not PAH, we can control it by giving these drugs. So coming to the Garbhini Pandu. So this is one of the main thing we Indians face. So anemia in pregnancy is one of the commonest, especially in rural areas, but still in urban areas also because of many faulty diet habits. It can even appear in all kinds of society and people. So the incidence will vary from state to state. So why there is anemia? Sometimes anemia may be seen in early weeks also. We will have to ask them the proper history. If there is previous menorrhagia, previous dysentery, or bleeding piles, or if they are not having enough nutrition, that is malnutrition, or even tapeworm infection and other infections in the stomach, all these can cause Garbhini Pandu. So we should have the thorough knowledge about the digestion of the patient and socio-economic status of the patient. So it is very important in all the trimesters to check the hemoglobin percentage, because if the hemoglobin is, according to WHO, it is if it is less than 11, then we consider it as anemia. And we know that hemodilution is very common in pregnancy. There is increase in plasma volume, and then the red blood cells will be increased less compared to the plasma. So we have to see that, and then accordingly the changes has to be made. So if it is less than 10 grams in any trimester, firstly we have to avoid anemia, and if it is present, then we have to treat. So the treatment depends upon the gestational age. We all know. If it is in the first or second trimester, we can easily go for oral drugs. And if it is very severe, 7 grams and 8 grams, moderate to severe, then it is better to go for injections. Usually oral for S injections are available. So those can be given in alternate days, and there is a formula to calculate how much she has to be given with thorough what we call monitoring of the patient with the BP, or they can even sometimes develop anaphylactic shock and all. So you have to thoroughly with the monitoring of the patient, even early identification of the symptoms of itching and all has to be managed. And in patients who are nearing labor around 37 weeks and 38 weeks, then it is better to go for blood transfusion if the patient is having 7 grams and all. So all these plays a very major role. So these knowledge is also very important. So we can, if there is a repeated hemoglobin loss even after giving injections and all, it is better to go for peripheral smear to know what kind of anemia she is having. And serum ferritin levels also we have to go. And we can even go for stool examination in cases of suspicion of what we call tapeworm, roundworm infections. So in megaloblastic anemia, the peripheral smear will appear like this, and hemoglobin will be less than 10 grams percentage, and the folate will be less, and B12, you know that for the formation or for the erythropoiesis to occur, the folic acid and vitamin B12 are also equally important. And in megaloblastic anemia, the serum bilirubin also will be raised. My favorite drugs to avoid anemia in pregnancy are usually I start these from 12 week onwards. So Lohasava, you know that Loha is proved one of the best medicine without having any teratological effects on the fetus. It is proven to be safe because it is given bhavana with amla dravyas. It is very really absorbed compared to the ferrous salts and ferrous ascorbates what the modern people are giving. So Loha is one of the best thing, and Loha preparations are my favorite during pregnancy. They are very safer. Saptamrita Loha, Navayasa Loha. Dadimavaleha can be continued even in second trimester. Fairberry syrup is very good with all the combination. It is even having vidanga and other things where if there is any malabsorption and all, that can also be cleared with this syrup. So these are the list of drugs. Depending upon the patient, I will be choosing. So the common prescription will include Ferriberry syrup or Saptamrita Leha and Loha syrup from Kotakal Pharmacy. These are best given with all the safety. So coming to the hypertensive disorders in pregnancy. So this is one of the main topic. So the what we call the diagnosis is very, very important. And the diagnosis of exclusion is very, very important in cases of preeclampsia and all. So there are 5 categories of hypertension in pregnancy. It is gestational hypertension, preeclampsia superimposed on chronic hypertension, and eclampsia. So even though there are 5 categories, so misdiagnosis can lead to very dangerous condition to the patient. So it is very, very important to arrive at a correct diagnosis by advising proper investigation and by giving proper referral to the patient. So that plays a huge role in maintaining hypertensive disorders because the chances of IUD are very higher in cases of hypertension because patient can end up in different kinds of convulsions, and also even maternal mortality is higher in patients who is having higher BP of 180, 100 and all. So what is important? How do we diagnose? This is also very, very important. So in the 5 categories, whenever you observe blood pressure of systolic 140 and diastolic 90 mm of Hg equal or more, then we have to consider the diagnosis of hypertensive disorders. So first one is hypertension because of gestational, that is physiological. So this will usually appear after 20 or 22 weeks of pregnancy, or sometimes it is, in my practice, I have seen that patients at the end, around 32, 34 weeks, they will be having increased BP, which is more of physiological, which can be managed with yoga and our medications and relaxation techniques, deep relaxation techniques. And here in these patients, they usually develop after 20, 22 weeks, and there will not be any proteinuria in them. There is no pedal edema in them. And the final diagnosis is made postpartum 12 weeks. We all know this. So after 12 weeks, the BP becomes very normal. There will not be any issue. There is no need of medications. So this is simple. There is no issue with this kind of category. And coming to the second and most dangerous category, it is preeclampsia. So this is very, very important. Patient will develop edema and proteinuria. So proteinuria usually dipstick. It is random urine sample. You will get around 30 grams of protein leakage, or you can collect 24 hours urine sample and then it is sent. and around 0.3 grams of protein will be seen. So too much of proteinuria will be there because of compromised kidney functions. You know, hypertension is mainly because of endothelial damage, vasospasm, and also the renal threshold, which is increased in normal pregnancy, will not be there in hypertensive patients. And there is changes in the angiotensin too. So there are different pathological entities. There is no pinpoint reason why there is hypertension in this patient. So it is even common in some races, ethnicity, and in some kind of African women where there are the incidence is very much higher side. So we even get so many patients of preeclampsia which can be managed. And whenever you get a patient of preeclampsia, it is very, very important to be on safer side and take a physician opinion. They will be putting them on some medications because only Ayurvedic medications can manage, but suddenly there can be shoot up of the BP, where I have observed in few patients. So at that time, the medico-legal aspects will come. So it is always better to take a physician opinion. They will put the patient on any calcium channel blocker like labetalol, hydralazine, depin. Previously, it was alpha-dopa. So all these medications will be prescribed by them. Along with that, we have to manage. It is not that we can say that we will manage everything with Ayurvedic medicines. In some cases, it may not be possible, and the patients and the baby's life will be at the stake. So it is very, very important in such conditions where there is life and death, and where there is chances of IUD, where there is chances of oligohydramnia, small placenta, and even preterm labor pains will come. So all such conditions, all such complications will be seen in preeclampsia. Suddenly they will end up in tonic-clonic seizures also. So it is better to refer if there is it can be presenting in two modalities. One is moderate, where the BP will be 150, 100 and all. In some patients, it will be even severe, where the BP will be becoming 160, 110, 170, 110. So in such conditions, it is always better to take a physician opinion and put her on some modern medications. So in this also, there are some patients who are chronic hypertension. So the BP will be more than 140, 90 before 20 weeks of pregnancy. So if the BP is more before 20 weeks, then we consider that patient as chronic hypertension. So it can be secondary to renal and cardiac pathologies. It can be managed, and there is no bad prognosis and vasospasm like in preeclampsia, like kidney damage, liver damage, and the placenta will be small, vasospasm, IUGR, and even the brain will be affected. So I forgot to tell, even the symptoms of headache, vomiting, nausea, abdominal discomfort, oliguria, all these symptoms are very important in preeclampsia. So that severity is not seen in chronic hypertension. And one more fourth category is chronic hypertension. The patient will be having BP before 20 weeks. And after 20 weeks, the patients will develop proteinuria and even edema. So that we call as preeclampsia superimposed on chronic hypertension. That is also a severe condition that has to be managed like preeclampsia only. And last one is eclampsia. That is, the patient will develop convulsions. They should be put in dark room with all the facilities, and there can be even termination and sudden loss of the baby or the fetus. Even IUDs can happen. So that has to be better referred than to be managed. So the main investigation to exclude are very, very important. In case of preeclampsia, usually the serum urea, uric acid, creatinine levels are high. So with the mismanagement or with the better management, also sometimes the patient will end up in HELP syndrome. So HELP means elevated liver enzymes and hemolysis and low protein level, low platelet count. So this syndrome is also common in preeclampsia. So even in that patient, the coagulation profile is altered and PPH is very, very higher in those patients because of increased BP. So they will bleed too much after delivery, though that also should be a caution. And that in such patients, we should not give them methergine. So other kinds of drugs should be given because it causes sudden higher in hypertension. So the basic diagnosis is made by urine protein. So albumin, it is mainly by dipstick. So it can be either 2+, that is 60 grams per liter, whenever the urine samples are taken randomly, and we can even collect 24 hours when the patient is on catheterization. So 0.3 grams can be seen. So what I advise to the patients is Prabhakaravati and Maharshi Amrita Kalasha, and I forgot to mention here Suvarna Vasanta Malini Rasa. So they are antioxidant and they will help in proper circulation, and even they help in normalizing the endothelial damage. Maharshi Amrita Kalasha is having around 50 drugs which all have antioxidant properties and which will nourish the circulation and also the baby or the placental circulation and the fetal circulation. And Cardorium plus is again Hridya Dravya. This also helps. And we did thesis on Rudraksha Prayoga. So the commonly Rudraksha which is available is Panchamukhi. So against uneven surfaced stone, we can rub it, and then whatever the thing is coming after 10 rounds of rubbing, so that can be given or kept on the pregnant lady's soft palate. It is easily absorbed. It is Tikshna, Vyavai Vikashi Guna is there that will go completely into the circulation and will be managing. So even though it is not mentioned in any text, my guru Dr. Ramesh has practiced this, and even I have got good results in cases of moderate preeclampsia. Sometimes even with labetalol and hydralazine, patients will not be having enough control or not having proper perfusion and not having other abnormalities. They end in complications. But whenever we are supporting with our drugs, the prognosis has been really good that we have seen. And Depin 5 mg or 10 mg that can be given. And in patients whom we are suspecting convulsions, for them magnesium sulfate IM IV can be given and can be referred. So the next common complaint what we see in pregnancy is vaginal discharges, as it is mentioned in Garbhini Upapluta. So we should know what is physiological and pathological vaginal discharge. So the discharge which is non-offensive, non-irritant, whitish and mucus or watery should be considered as physiological. So because of the changing pH during pregnancy, there can be many kinds of infection like trichomoniasis, candidiasis. So if these infections are not treated, it can lead to IUGR and even septicemia during delivery. And we should always, whenever a patient is complaining of watery discharge, we should rule out premature rupture of the membranes, because ascending infection, and if there is PROM, the baby will be undergoing infection and then can end up in other complications. So in pathological conditions, when there is recurrent huge white discharge, then the patient should be checked with sugar levels, and she should be tested for gestational diabetes mellitus. And if there is any faulty cleaning methods, so many patients will not be having proper cleaning methods. The cleaning will be from the rectum or from the anus towards the vagina, that usually so many patients will be having this kind of cleaning habits. So those should be altered. And if the patient's husband is infected and there is often intercourse, then also there can be infections. So all this history should be made, and then abstinence whenever you are giving treatment. And as it is mentioned in Upapluta, Datakyadi Taila has been made in many patients. Thesis has been given to my student where Datakyadi Taila Pichu. So usually we will not go extensive Varti Prayoga and all in pregnancy. We go for Prakshalana and Pichu. So along with that, we can give her Leucol tablet from Himalaya. This has given us good results. As we were discussing torch positive pregnancy, we should know whether there is active infection or passive infection. So if the IgG is positive, then it is chronic. She is already immune. There is no need to worry. If there is IgM positive, it is better to go for Panchakarma. And if she is in first trimester, we have to again check for all NT scan and amniocentesis and other things to know the terminological effects. So even if it is too much huge and there is fever, rash and other symptoms in the patient, it is better to terminate. Or if IgM is negative only, IgG is positive, then we can continue the pregnancies with Falasarpi and torch milk capsule. And we give Kshiropakas particularly from first month, second month, third month, different kinds. Bala, Gokshura, Shatavari, Stira. So different kinds of Kshiropakas are those. Those can be given particularly to the torch positive pregnant women. So one more complication which is very common sometimes, even though there is nothing, we think of abortion, like in placental sign and all, the decidua vera, where uh, the space which is left without occupied in the first 12 weeks, there can be bleeding, which is called as placental sign. So in such bleeding, we have to do proper Garbhini Paricharya. And the patients with USG positive with retroplacental clot and there is a bleeding, then we have to give them Garbhasrava Chikitsa. And if it is antepartum hemorrhage, usually comes after 22 weeks, either in second or third trimester. They're majorly because of placenta previa or abruptio placenta. Those also can be if there is multiple cesarean sections before multiple deliveries, that time or previous cesarean, there are more chances of placenta previa. And APH, trauma or folic acid deficiency or uncontrolled BP, those patients will be having APH and sudden death of the baby and then bleeding. So all these major cases has to be identified by proper diagnosis and clinical examination. In first trimester, some patients will be having spontaneous abortions, as we know that natural wastage of the fetus whenever there is an embryonic gestation, molar pregnancy, or trauma, maybe excessive sexual intercourse or sudden fall or shock. All those can also cause abortions. And vasa previa and other things also can cause sudden bleeding and IUDs in last weeks of pregnancy. And in ectopic pregnancy also there can be abdominal bleeding or vaginal bleeding. By proper investigations and diagnosis, we have to treat. Sometimes it will even be ruptured ectopic where we have to rush them into the OT. So we are just discussing about the medical illness in pregnancy. So I will not be going deep into the surgical illnesses in pregnancy. Sometimes even cervical erosion, cervical polyp can also be giving into too much of bleeding, rising into anemia. So those has to be managed, what we call not with a too much active treatment, but with passive kinds of treatment. So whenever a patient is having pregnancy of 2 months or 3 months with bleeding with retroplacental clot, but with all what we call the fetal heart rate is good and the fetal pole is good and the fetal sac is developing properly and the crown rump length is good. In such cases, we have to continue the pregnancy by giving proper complete bed rest in cases of threatened abortion. So Falaserpis is always favorite, even though with or without complication, that has to be continued. And Garbhapala Rasa, Stiplon, 2 TID, and Utpala, that is white lotus, either it stems or even Kandamula, what we call. So all that has to be collected and then Kshirapaka has to be made. And Stira is available that can be made into Kshirapaka and has to be given. And when there is too much of cramping, abdominal pain or burning sensation because of bleeding, Panchavalkala Kwata is made and then the dressing pad is soaked in it and then it is made cold and then can be applied on the lower abdomen 4th hourly for 2 days. And as it is having Kashaya Rasa and Shitavirya, bleeding also will stop. We know that there is direct absorption of the drugs into the abdomen. So through the skin also the drugs will absorb. So foot end elevation so that there is no pressure on the abdomen. And in patients who wanted, there were so many patients without an embryonic gestations or sudden, first the FHS will be there, later it will disappear at 7th week. In such patients, even we tried with Ayurveda to induce menstruation. So instead of going for MTP, Hingu and Haritakya Yoga, so all Anulomana Javya Dashimola, all those, and even Dashimola Katutraya along with Gandharva Hastyadi Taila and Hingu Triguna Taila. So all these drugs were given depending upon the patients and other Vatanulomana Chikitsa or even Pranayama, Panamuktasana along with the drugs. So that has also given us the complete induction of what we call pregnancy or termination of the pregnancy. Some patients will be having always giddiness first trimester and second trimester, mostly of Pitta Prakriti. So suddenly there can be hypotension, hypoglycemia, and sometimes it can be ectopic rupture also in early weeks. So going for proper scan is also very important, and going for vitals. Sometimes it can be because of general debility and strenuous work at workplace. So those has to be more monitored. Giddiness should not be neglected. She should be observed. If there is no other cause seen, I used to give them Kamadugarasa and Sarivadhyasava 2 teaspoon BD. The patients will respond better. And sugar levels has to be managed. Postural hypotension also can cause giddiness in patients with anemia and other complications. Gestational diabetes is increasing nowadays because of higher BMI, obesity, and even post-COVID, many patients are getting, after vaccine, post-COVID, patients are getting increased sugar levels. So here diet plays a major role in regulating the sugar levels. So usually I will ask them to include vegetables like bitter vegetables and green leafy vegetables like spinach, methi, cabbage, cauliflower, sponge gourd, and pulses like green gram, chickpea, cereals, barley, oats, bajra, so and the old rice, and in spices usually to include turmeric, cinnamon, fenugreek seeds, and the fruits like mainly jambu. Even though it is seasonal, so plums, kiwi, orange, guava, amalaki. Amalaki will be again can be available in stored forms also. Dry fruits to soak at night, almonds, apricots, and walnuts. Yogasana also the sideward bending and asanas like Katichakrasana, Trikonasana, Virabhadrasana will influence the pancreas so that it will manage insulin. It will manage insulin. And pranayama, especially Brahmari, Anuloma Viloma pranayama. So this also will improve the circulation and proper absorption of the glucose. So relaxation is also very, very important. When there is huge or increased stress levels, that can also cause glucose intolerance. So yoga will carry the proper energy, oxygen and other energy to all the parts of the body. So the tissues will readily absorb the glucose and then reduce the stress over the pancreas to release excess insulin. So that is diagnosed majorly. The diagnosis is very, very important. That the choice of treatment is Kledahara or Kafahara or Virukshana Chikitsa. So we usually go for GTT, glucose tolerance test at 22 weeks to screen the patients who is having the history of IUD or whose BMI is more than 25 or previous history of IUD and all. So if the fasting blood sugar levels are less than, it should be less than 100, 120. And first hour we check after giving 100 ml of glucose along with 100 ml of water. So first level should be less than 180, second less than 155, around third will be less than 140. So any abnormal values, any two abnormal values in these four entities, if you are getting, then she will be diagnosed as GTT. And even after the yoga and dietary changes, if the RBS always remains more than 130, 140, she should be given medications. So there are different kinds of medications. So Shilajatu, Dhatri Loha, Jambwasva, Punarnava, Mandura, Asanadi Kashaya, Nishamlaka Prayoga, Nisha Katakadi, and Kataka Katiradi. So all these kashayas has given good results. And here also we have to keep in mind that anytime because of sudden hypoglycemia, the patient will go for IUD. So termination after 36, 37 weeks, because the babies will be usually bigger, but still they will not be having proper maturity. So after proper lung maturity, termination is very, very important after proper maturation of the fetus. And the type of delivery has to be depending upon the cervical ripening and the contractions. Sraya gravidarum, as in Garbhini Paricharya, it is mentioned in Akshamatram Navanitam Ashniyat in 4th month of pregnancy. So around 2 talas. So around 42 or something will come. So that much of internal Navanita should be given so that it will increase the stretchable capacity of the tissues, especially the abdominal tissue. And it is mentioned different Thailas, Karavira Thaila, and so many others are available. They have mentioned. As they are not available, I have tried with Ushira Chandana Kalka. So any kind of discoloration will come down, itching will come down. So some patients will be even having near the tissues of the breast and thighs. There also these can be applied. But Asana Bilvadi Thaila has given very good results compared to even calamine lotion and other lotions what the modern people are using. So internal and even external application of Navanita is really beneficial for the patient. So backache because of lumbar lordosis, faulty diet, faulty walk, all these can cause backache in pregnancy. So supporting and nourishing the back is very important. Either it can be with the local applications. There should not be any massage. And Kukutandatwak Basma, where it is present in Mikal. And avoiding the diet like horse gram, chana, rajma, all such kinds of diet can be avoided. Vajrasana is very good to strengthen the posture. So with the simple techniques, only the backache can be relieved. Sometimes it can be because of white discharge, constipation, urinary tract infections. Those has to be managed, and if the cause is different, the cause has to be treated. Constipation because of the stasis and progesterone effect, it is also very common. So the food changes. So they should be always be given with Deepaniya Dravya and Pachana Anulomana Dravyas. So even they can use jeera in buttermilk, and then it should be taken 2 times a day. And even with the dietary changes, if still persists, it should not be given for very long time medications because they will be accustomed. Anuloma DS tablet, Kusmabia with Haritaki, Tripla Churna, and diet, semi-solid diet, which is usually digested within 2 or 3 hours, should be given in repeated quantities. So this will also relieve. Garbhini Mutra Prachara is also very, very common because in pregnancy, it is immunocompromised and the urethra will be smaller, and because of the change in vaginal pH also, patients will be more prone for UTIs. So if there is no too much of infection, we will be finding more of RPCs, pus cells, and epithelial cells if it is more than 15-20. Even with all the investigations, we have done different kinds of theses on different kinds of patients. So Narikela Yoga. So Dhanyaka around 20 to 30 grams along with Guda, Purana Guda. It was mixed and made Kalka, and with 200 ml of the tender coconut water as Anupana was given to many patients. It has given wonderful results. Another thing is Bruhad Datriadi Ganavati, where Ikshumula, Haritaki, Amalaki, and even Gokshura. So all these drugs are also there, Mutra Virajaniya drugs. That is also has given good results. And the what we call the traditional preparations of Chandanasava, Bangshil, which is having Chandraprabhavati or Shilajat. Usually I give it after 12 weeks of pregnancy whenever there is UTI. These also has given good results. So coming to IUGR, so based on whether it is symmetrical or asymmetrical, our treatment approach should be there, and proper knowledge should be given to the patient. So symmetrical, usually all the cell volume is lost. So only we can do is hypertrophy. So the chances of improvement are less compared to the asymmetrical IUGR, that is the loss or decreased weight or unable to gain weight up to 5th percentile, what we consider as definition, that is intrauterine growth retardation. So we have to even see whether there is small for gestational babies or constitutionally small mothers, and whether exactly IUGR is there or not, and whether the umbilical cord is having 2 veins or normally sometimes only one artery, one vein will be there. We can even give better results and good baby weight. And whenever it is symmetrical, it is difficult to treat such kinds of patients. So what I usually give is Bala Ashwagandhadik Kshirapaka. So the churnas should be mixed and then it is in 250 ml of diluted milk. It has to be boiled and filtered and then given. Palasarpes and Pipalyadigrita are rasayanas. They will also improve the baby's weight. And Mamsarasa, so Kukkuta, either Kukkutanda or Kukkuta Mamsa are very good and rich in protein. So that will also improve the weight of the baby. So AFI without any complications, AFI will be less in cases of congenitally abnormal babies and also in patients who is having hypertension. And even the drugs what we use like alpha-dopa, labetalol, those are all having side effects. They will cause oligohydramnias. In those cases, Pipalyadigrita, Shatavari Kshirapaka, Palasarpes are given. So that will improve the perfusion and uteroplacental circulation, perfusion, all those can be improved by these drugs. And even Vastis also will help. In polyhydramnias, there is more of Kleda and Kapha, which is usually seen in gestational diabetes mellitus patients, and also it is seen in congenitally abnormally babies. So in such cases, even though it is said that Lekanadravyas should not be given, Kashaya should not be given, but if there is excessive Kleda, we have to give and normalize. So methodical with proper examination and proper monitoring. I have given Gokshiradi Gugula Varunadi Kashaya. So every week the patient has to come. The patient who are having 26 centimeters of liquor have reduced to 18 in 2 weeks by giving these drugs. Later we stopped the drugs and she managed and even ended up in normal labor. Her sugar levels were not increased. It was idiopathic polyhydramnias in that patient. So one of the main complications what we see nowadays is premature labor pain. So many times it can be because of indigestion, UTI, vulvovaginal infections, and most of the times it is idiopathic. We cannot identify any cause, but still they will come with pain. With previous history of LSCS, they will be saying scar tenderness and all, where the obstetrician will be in what we call, they will be under dilemma whether there is scar tenderness and all. Usually it is more what we call dangerous when it is in and around the labor. So especially with previous history of cesarean and the patient is coming intermittent pain abdomen around 34 weeks. So in such cases, the patient, so many patients even they will not respond with Duodlon antibiotics if there is unidentified inflammation and all. So in such patients, we have given Lodra Pippali Yoga, which is mentioned in Garbhachalana Chikitsa. There is month-wise Garbhachalana Chikitsa in mentioned by Yoga Ratnakara. So Lodra 200 grams, Pippali 5 grams, along with honey it is mixed, and then Kshira was given as Anupana. So that has also given promising results. And Shatavari Kshiravasti for continuously 3 to 5 days. That has also relieved the pain. So neurological strength, and Shatavari may be acting as beta adrenergic antagonist, which will stop the labor pain. And Mahanarayana Taila Anuvasana along with Shiravasti can be added in patients of pain with too much of Vata symptoms. And orally Palasarpes, Dhanavantari and Himcospas. So these are the set of the drugs what I usually use than Duodelon. So these are the main topics which I wanted to cover in the time given to me. So conclusion, as it is told by Acharyas, the pregnant lady should be treated like Taila Purna Kumbhamva. So as the pot filled with oil, even with slight oscillation can lead to different kinds of problems in pregnant lady. So we have to always do Mrudu Madhura Shishira Sukumara treatment. We should not go too much into extensive treatment unless and until it is very emergency. And Garbhini Paricharya is always basic and unique. So we should never forget the basics. And it can be modified and tailored according to the need of the patient, especially in medical complications in pregnancy. And yoga, I will be giving in first trimester mainly to improve the organogenesis too, and in second trimester to improve the weight and growth of the baby, and in third trimester to aid normal delivery. And mantra is also one of the area where there is too much of research and extensive research is needed. So each month, as we have Navagrahas, each month there will be more predominance or influence of Graha. So if there is more of production of Rakta, then they consider it as Mangala Om Mangala and Namah. That is also there is a research done. If there is too much accumulation, stay buddhi, if the 6th month there is development of intelligence. So Mercury or Buddha Graha we consider as the cause for intelligence. So Om Buddhaya Namah. So such kind of research is still going on, and mantra chanting will still improve the psyche, and there are many other what we call beneficial effects by mantra chanting. Still there is no enough research how to chant, how much to chant, and what is the indication, specific indications, who can do, who cannot do. So this is still my area of research, and thanks for patient listening. You can ask me any questions if I have missed any topic.
Very nice, ma'am. Very beautiful presentation. Indeed, it was really great. So one question is there from Dr. Rachana. Pregnancy with IgM positive, then what should be done?
IgM positive, we have to see, ma'am, from how many days she is having, and depending upon the history of.
Can you stop sharing? So one-to-one discussion will be there. Yeah. Yes. So
it depends upon the range. If it is on the higher side, too much higher side, there is too much of spirochetes will be present, and the viral load will be more. If the viral load is more and there is symptoms, it is better to terminate and then go for panchakarma and our medications to rejuvenate, and then it is better to go for treatment and continuation of pregnancy. If it is moderate, as I mentioned, it can be continued with the Phalasarpis and torsion.
Yeah, yes, ma'am. So is it okay, Dr. Rachana? You can unmute yourself and ask the questions. Another one question is there from Dr. Rachana. What will be the quantity of Shatavari Kshir Basti and how long Google can be given? Ma'am, one more question I just want to ask also. Shall we prefer Google in any form for any condition as it is like Ruksha Khara quality? तो कितने दिन हम लोग दे सकते हैं if we prefer?
If there is any too much of kapha and kledha increase in that patient, particularly we can give to them for 1 week to 2 weeks maximum, because later on the gugulu will be having all that lekana property, and there is a chance that they can go into oligohydramnias and sudden hypotension and even hypoglycemia. Pregnancy is very sensitive state. So beyond 2 weeks, I usually don't prefer. So it should be given with adjuvant like milk whenever she is taking, or some other medications or some foods like that whenever you are giving it, so that to combat the effects of or the negative effects of the drugs.
Okay. Yeah. Dr. Baljot, please unmute yourself, ma'am. Treatment of high LFT patient complaint itching all over the body and reduced appetite. So is it in pregnancy, Dr. Baljot, ma'am?
Yes, ma'am.
Yeah. Namaskar, ma'am.
Namaskar, ma'am. And thank you, ma'am, for very nice presentation.
Yeah, it was really great. Yeah. Yes.
Yeah, I miss the liver disorders in pregnancy. So many patients will come with increased LFT, especially the bilirubin level.
Yes.
Even the alkaline phosphatase will be increased. In such patients, we have to see whether there is any other infections. The hepatitis A, B, C, D, different varieties are there. So if they are positive, then we have to look at it. Sometimes without any things, the itching will be more because of bilirubin, increased bilirubin. So same things, like we have to give them Arogya Vardhini, Leave 52, and what we call Rohitaksha Kashaya I have given. And they are very pungent or very thick dravyas. Patients will not be able to take, but Arogya Vardhini Vati 2 TID if there is too much of itching, and Asana Bilvadi Taila application will really help than calamine lotion.
Okay, thank you, ma'am. Thank you so much.
Another question, Shatavari Kshira Vasti, because usually I have given this in late weeks of pregnancy. After 32 weeks only we are going for Vasti. So it was usually we prepare up to 400 ml, but the retention capacity after pushing 250 ml only, the Vasti Dravya will be coming back. So in such conditions, we are even going for Nyubja position and then administering the Vasti, which is mentioned by Acharyas. So then the administration of the Vasti Dravya becomes easy. So that can be done up to 300 to 400 ml you can prepare and give daily. there is no issue whenever you are giving Shiravasti in conditions of AFI, which is reduced, and even in IUGR conditions, you can easily administer up to 400 ml. Am I clear?
Yes, yes, yes.
Yeah.
One question is there from like, in the case of thalassemia minor and anemia, patient is trying to conceive. What should be given for the anemia?
So there are thalassemias are autoimmune disorders, which is very difficult. So we have to ask them to go for some panchakarmas, and then what we call Indukanta Grita should be given continuously for them. And we have to prepare them prior to pregnancy by giving Shodhana. Virechana is one of the main thing where the Rakta Shodhana will happen. So posting them with Indukanta Grita, Snehapana, and doing Virechana, and at least their rejuvenation should be more. And then she has to come to the pregnancy, and then again we have to go for peripheral smear and other causes of anemia. If still anemia persists, the supporting kind of treatment like Garbhini Pandu, and with Rasayanas we can manage the pregnancy.
Routine course of Virechana, ma'am, like for Shodhana?
Routine course, yeah, routine only. Indukanta Grita, Snehapana, and then 3 days with Manjishtadi Taila or Dhanvantara Taila, what we call Abhyanga, followed with, depending upon her constitution, Trivrit Leha or anything can be given for Virechana.
Is it clear, Dr. Gautam?
Yes, ma'am. Thank you, ma'am.
कुछ और पूछना है डॉक्टर बिमला? आपका केस बताइए मैम.
यस मैम, नमस्ते मैम. मैम मेरे पास एक पेशेंट है, उसकी एज 30 इयर्स है, और वो मेरे पास, ये एक्चुअली मैम प्रेगनेंसी से रिलेटेड नहीं है, तो मैं पूछ सकती हूँ अभी?
पूछिए ना, पूछिए.
जी, तो मैम 30 इयर्स एज है पेशेंट की, और वो मेरे पास में लोअर बैक पेन और लोअर एब्डोमिनल पेन सिम्टम लेके आई, और उसको पीसीओडी की हिस्ट्री है ऑलरेडी, और 1 ईयर बैक वो मेरे पास में आई थी मैम सर्वाइकल इरोजन लेके.
ओके.
तो अभी उसकी कंप्लेन थी कि मैंने जब उसका पीएस एग्जामिनेशन किया मैम, तो एक ट्रांसपेरेंट सा फ्लूइड, ब्लड मिक्स्ड फ्लूइड आता हुआ दिखा मुझे सर्विक्स के अंदर से.
ओके.
तो मैंने पैप टेस्ट के लिए भेजा पेशेंट को, तो पैप स्मीयर में मैम एंडो सर्विसाइटिस करके उन्होंने डायग्नोस किया है.
ओके.
तो मैम इस केस में हम किस तरीके से सोचें, क्या वो करें?
शी इज ऑलरेडी हैविंग इश्यूज, उसका बच्चे है.
हाँ, यस मैम, शी इज हैविंग 2 चाइल्ड्स, बड़े बच्चे हैं उनको.
इज शी ऑन प्रॉपर्टी?
और मैम इनकी मदर को लेकिन क्या, नो मैम.
So you did good job that you have gone for pap smear. It will be usually inflammatory smear, but still 6 months once it is better to do. You, as you are saying, there is history of cervical cancer, and whenever there is endocervicitis, the cervical tissues will be in chronic tissue insult, which in long run can lead to cervical cancer. In such cases, it is very important to manage the immunity, and locally you can even go for Ksharakharma. So I myself have done Ksharakharma.
Ma'am, dear, 1 year back. Ma'am, 1 year back I did Ksharakharma.
Okay.
उस टाइम मैम उनकी जो सर्विक्स थी वो वेलवेटी रेड दिखाई दे रही थी, क्लियर दिख रहा था कि हाँ इरोजन है.
ओके.
लेकिन अब उस टाइम मैम मैंने क्षारकर्म किया, धातु आदि तेल का पिच्चू भी रखा, तो सर्विक्स इनकी बिल्कुल ठीक थी. लेकिन अगेन 1 year आफ्टर 1 year व्हेन शी केम, अभी कंडीशन सर्विक्स का ऐसा है.
ओके. सो इट इज ओनली सर्वाइकल एरोजन और?
तो मैम अब फिर से क्षारकर्म और नेपोथियन सिस्ट.
ओके. इज शी हैविंग वाइट डिस्चार्ज, ऑफेंसिव स्मेल और पीआईडी, अदर सिम्टम्स ऑफ पीआईडी?
Yes ma'am.
You have her
slight white discharge is coming.
Cycles are regular or PCOD is there. So whenever there is PCOD, there will be unopposed estrogen.
PCOD is there.
Yeah. Whenever there is PCOD, no, there
Yes.
Yes,
ma'am.
Which will cause Nabatean follicles, and there will be local infection and too much of.
Yes.
So that also you have to treat. You go for one Vamana Karma.
Yes, ma'am. Nabatean cysts.
Yeah, tell
me.
Ma'am,
voice is not clear.
Tell me.
Voice is breaking, ma'am, in between.
Am I audible now?
Yes, yes.
Yes, ma'am.
Yeah, you try to reduce the estrogen. That is very, very important. The peripheral
Yes.
estrogen, and if the patient's weight is more, there will be conversion of the peripheral fat into estrogen again. So in PCOD patient, do the lifestyle changes, ask her to go for exercise as she completed her family. You give her on pranayama and other what we call lifestyle changes, and you ask her to go for vamana if she is having arthavakshaya lakshanas. If she is having astudhara, go for virechana, and you go for uttaravasti also. Okay, you go for uttaravasti with kasi sadi taila, and then if she is responding well orally also, you have to give them shodhana dravyas. That is important.
So
Okay.
full course of panchakarma is needed.
Yeah, one
Okay.
karma is
Yes.
needed and treatment of PCOD is needed. Along with that, you can go for Uttaravasti and give her Leucol tablet and GP 500. Gandhakarasayana is indicated in patients who is having chronic cervical erosions. So GP 500 capsule is there, that is very helpful. Okay, you can give it to her. And to reduce the Shota, Nabothian follicles will increase the size of the cervix. So to reduce the
Yes.
Shota, you can go for Trayodashanga Gugulu. So Trayodashanga Gugulu, GP 500 and Immunoxin tab is available. So these three medicines you can give her for 15 to 20 days for what we call present scenario. And later on,
Yes, ma'am.
plan your treatment once the symptoms are reduced. As you are saying, there are no other symptoms. Cervical erosion is a clinical diagnosis. She's not
Yes.
having. It can be sometimes because of PCOD and its complications. So give her complete treatment. It is not just cervical erosion treatment. And do pap test every 6 months once.
Yes, ma'am. Okay, ma'am. मैम
Yeah.
एक क्वेश्चन और था मैम, वाइट डिस्चार्ज के जो केसेस हैं उनमें कई बार हस्बैंड भी इन्फेक्टेड मिलते हैं,
Yeah.
तो मैम उस केस में हमें किस तरीके से सोचें?
So usually whenever you are giving white discharge treatment, you have to know what kind of a white discharge, whether it is
Yes, ma'am. Which type of investigations we have to
yeah,
be
see,
done here?
look at and then observe the smear under the microscope. If it is creamy green, it is trichomoniasis. It is flaky white, yeast infection, candidiasis. If it is plain white and chronic, then it is normal physiological. So based on the organism you have to see, and even based on the dosha. If it is kapha pradhana, then you go for varti treatment, dupana treatment. If it is vata pradhana, go for pichu. And oral medications, however, we have best medicines, Ashokarishta, Leucol, Pushanaga Churna, Lodradi Churna, Lodra Sava, so many kinds of drugs we have. Orally only we can control 50 to 60%, and 30% Stanika Chikitsa is very, very beneficial. And whenever patient is in treatment, barrier methods of contraceptions are very, very important to use. And for husband, however, metronidazole, other kinds of medicines can be given so that the patient will not be infected again.
Definitely.
Okay.
Very nice, ma'am. Yeah. Thank you very much. Dr.
Thank you very
Sampada,
much,
आप
ma'am.
भी पूछिए. Dr. Sampada, your case was there, na ma'am? One more question from Dr. Baljot. What will be the treatment for the PCOD in 12 years of girl?
Nowadays, PCOD has become a gynecological pandemic, but in 12 years,
Yeah,
usually,
definitely.
it is mainly because of hormonal changes. The uterus is still developing and the HPO system is still adapting to the physiological changes, what is happening. You don't need to do too much of extensive treatment. It is just Artavajanaka Dravya, keep her under proper lifestyle, and even 12 years girls are having stress nowadays. So going for Shavasana is very, very important because it
No voice, ma'am. नो वॉइस मैम. डॉक्टर पद्मा. You are muted, ma'am. Unmute कीजिए. You are muted.
Okay.
Yeah.
We are done with the questions, I think.
Okay. Is it clear? One more question is there from Dr. Rachana. Madam, Dr. Rachana asked directly, so it will be clear for all.
Yes, ma'am. Hello.
Yeah,
Yes.
tell me.
Ma'am, you said for premature labor pains, 200 grams of Lodra and 5 grams of please to be given. But what is the dose, single dose, ma'am?
200 grams, I did not hear.
Ma'am,
Premature
200
labor pain.
grams.
Okay.
Yes,
So
ma'am.
it depends upon actually whatever is mentioned was what the thesis, what we have done, or in 10 patients, we have done a clinical trial. So
Yes,
my
ma'am.
teacher is Dr. Mamta KV from Udupi. So when I was there, we are trying was
Hello.
given around 100 or 200 mg based upon the patient's pain. If the intermittent contraction was there for more than, if it is coming every 5 minutes once, we used to
Yes,
give them 200 grams of lodra along with 5 grams of pippali, and then it is mixed with enough quantity of honey, and then it is made to lick, and then the anupana milk was given 100 ml. So this depending upon the contractions, if it is very repeatedly or oftenly coming, we used to repeat the dose every 4th hour, or else it is given every 6th hour or 8th hour, depending upon the contractions or the pattern of contractions. The dose was changed. It was not particularly one dose in all the patients.
Okay, ma'am. Thank you, ma'am. Thank you.
Dr. Sampada, please.
Yes, good evening, madam.
Good evening. बताइए.
Madam, मेरा एक question था. In many cases, patient have pedal edema with thrombosis. Hello, madam. Hello.
Yes. बताइए मैम. बताइए.
उसके लिए क्या solution होता है?
Hyperlipidemia?
नहीं, hyperlipidemia नहीं.
Thromboembolism in pregnancy.
वो मैडम मुझे याद नहीं आ रहा वर्ड अचानक.
अच्छा, बताइए. हिंदी में बताइए सिंपल. क्या लक्षण से बताइए, सिम्टम्स क्या है बताइए.
पेडल एडिमा और enlarged varicose veins.
Okay.
Prominent varicose veins.
Yeah, that is one of the cause. Because of varicose or loosened veins, there can be pedal edema. So whenever she sits or sleeps, it should be with a little height. So a stool to support the circulation, and even while sleeping, it is better to keep 2 pillows to increase the venous return, and also to improve the uteroplacental circulation when she is conceived. Okay, varicose veins is one of the anatomical thing. Only with crepe bandage she can tie little tight, not too much tight, because circulation cannot be hampered in pregnancy. So it is very, very important for us to maintain the posture and also the circulation. So varicose veins, we cannot do complete treatment. Sachara, thyla can be applied, but Gugulu is the main line of treatment because of inflammation that cannot be done. Or short saphenous vein and long saphenous veins are the main veins which are involved. Surgery can be done after the labor, but conservative management should be done in pregnancy.
Okay, ma'am. Okay. Thank you.
मैम, एक रूटीन और क्वेश्चन आता है हमेशा कि ब्लीडिंग अगर हो पर वजाइना ड्यूरिंग प्रेगनेंसी, सो इसमें क्या करें हम लोग? लाइक स्पॉटिंग भी होता है कभी-कभी.
Yeah, that we have to see what is the cause. If it is in the first trimester, we have to see if there is any retroplacental clot, or if there is any cervical erosion or cervical polyp. Proper examination. Sometimes even with what we call abruptio placenta and placenta previa. So proper scanning should be done, and proper clinical examination should be done. Based on the reason, we have to ask them. Or just to stop the bleeding, we can give them Stiplon 2 TID from Himalaya. That also will immediately stop the bleeding.
Stiplon, okay.
Yeah, Stiplon tablet, and changing her diet. Like
Stiplon for how many days, ma'am? 15 days?
Yeah, that can be given up to 15 days, but the dietary changes should be made.
Yeah. And for constipation, you just told Triphala Churna and something like
Anuloma DS and Kusumabhaya capsules are usual prescriptions.
Kusumabhaya capsules.
Yeah, capsules. It is majorly made of haritaki.
Okay.
So that can be given.
Okay, and the last question of this session is that if a patient is suffering from amenorrhea since 2 years and diagnosed as a hair and syndrome, patient's age is 34 years. So, yes, ma'am.
Patient is suffering from amenorrhea since 2 years. Hair and syndrome.
Yeah, Dr. Rana, please.
Can you please clear this hair and syndrome?
Dr. Rana, Dr. Luvia Rana, please clear that. Which not understanding the situation exactly. Yes, please.
हेलो
Yes.
हेलो
हाँ बताइए मैम बताइए.
हाँ जी मैम ये पेशेंट है 34 इयर्स ओल्ड है और इसको एमेनोरिया की प्रॉब्लम है 2 इयर्स से. तो ये पीजीआई वगैरह जा चुकी है तो उन्होंने मतलब हेयर एंड सिंड्रोम डायग्नोज किया हुआ है.
What hair and syndrome? Can you explain the symptoms? Why she was diagnosed with that?
Ma'am, PCOD and hirsutism. These are the symptoms collectively. Yes, ma'am.
Okay.
तो she is
तो
complaining
शायद हेयर से शायद हिर्सुटिज्म यानी कुछ कहाँ पे है मैम?
यस मैम. तो
चीन
मैम हाँ यस मैम वो मतलब एंग्शियस है कि मेरे को पीरियड्स आने चाहिए कि इतनी कम एज में मेरे को.
अच्छा
34 हाँ जी मैम 34 years.
Yeah, we have to see nowadays every patient we have to see there are so many patients who are ending up with premature ovarian failure. So we have to see AMH values in them, and sometimes early menopause is also happening by 34 or 35 years. You have to see AMH and to see the follicular growth. Okay. So if she already has completed her family, you can put her on Falasarpi Pipalyadi. And like Artavakshaya treatment only, you have to go for Vamana and Vasti. Okay. So Yoga Vasti can be given, and even if she is already having kids, you can whenever you are giving Anuvasana, you can even do Falasarpi's intrauterine installation. So to some extent, this will clear if there is any moderate abnormality. If it is complete premature ovarian failure, then we can do only minimal treatments. If there is hirsutism and other things, it is mainly hormonals. So depending upon the cause, we have to treat what exactly is the cause.
Okay.
Is there any kalpa, ma'am, to remove such type of hairs as per Ayurveda? Like
previously, it used to come Kesha Shataka Taila. Now it is not available, but Aloes compound will improve the follicular activity, and even it has reduced. And in patients who are thin, you can even give Narasimha Rasayana. That also will reduce the thickness of the hair on the face.
Ma'am, she is anxious about amenorrhea. Then we will go for Vasti.
Yeah, you can go for Vasti. Artavakshaya, you have to correct Vata. Apana Vata has to be corrected. But you are not giving me full history. You are saying hirsutism, amenorrhea, that's all. We have to see complete history of the patient, married life issues, abortion, all these things has to be asked.
Ma'am, Kanchana Gugul is okay for such type of hirsutism, Arogyavardhini, Kanchana Gugul, such type of...
Actually, as it is hormonal, usually they will be having increased testosterone and SHBG will be reduced. So you can stimulate liver, but it is not complete treatment. Complete treatment is always normalizing the neuroendocrinologic system by Panchakarma and by proper follicular activity.
मैम डायरेक्ट वस्तीकरण कर सकते हैं हम या वमन?
It is better to go for either Radoshodhana or Urdhvashedana based on Artavakshaya or Artava increase. So later you can go for Vasti, then only it will be better absorbed.
Okay.
Yeah. Thank you, ma'am. Very nice. Just last question, Dr. Rachana is requesting. So, ma'am, yes, Dr. Rachana.
Thank you, ma'am. Ma'am, a patient age 26, just married for before 2 months and has an amenorrhea last 1.5 years. Her investigations are absolutely normal and endometrial thickness is about 6 mm. HB either hormones, all levels.
On
Hello?
which day of menstruation the endometrium thickness is
Actually, ma'am, she has amenorrhea for last 1.5 year. Then I randomly tested.
Okay, then there is the endometrium still thin, means she is not
Ma'am,
having ovulation.
yes, ma'am, 6
What is
mm,
her weight?
and ma'am, she is thin in stature, about 36 kg weight.
Other than endometrial thickness, what is her uterus size and ovarian size?
Uterus size is, ma'am, uterus size and ovaries are normal, and hormone level are normal, HB normal, and sugar level normal. Other all investigations are normal.
Okay. Okay. So from 1.5 years, she didn't get menstruation.
Yes, ma'am.
Okay.
Actually, ma'am, I think that it is Artav Shahjanya. Yeah.
You go for LH, FSH, and serum prolactin also.
Ma'am, serum prolactin is normal, TSH normal, LHFSH I have not done right now, and I will go for.
Usually it is higher center. Whenever the weight is less, usually the anovulation will be caused by the higher centers that we call HPO axis abnormality. So in such cases, you have to go for triggering the pituitary to release LH and
yes, ma'am. Ma'am, actually, I have started Nasya.
Yeah, that is good. You are doing. You can give with Falasarpi, all Kshirabala, or even there are different kinds of Ghritas. Even Brahmi Vati, Centella Asiatica, Vallari capsules are available in Kerala. So to stimulate the hypothalamus and pituitary. And Nasya can be given. So Nasya also will trigger the pituitary to release. And along with that, even Arthojanaka Dravyas like Allos compound, Falasarpis you can give. And that those will help.
Okay, ma'am. Thank you so much, ma'am.
Very nice, ma'am. Very nice. Really great. So I request Dr. Anjana ma'am for vote of thanks. Very nice, ma'am. Thank you very much. It was really wonderful, and it was really helping in the general practice, because there are so many issues regarding the pregnancy में क्या ये है तो क्या दे, वो है तो क्या दे, ये हमेशा से होता रहता है, तो really it was great. Anjana ma'am, please.
जी थैंक यू मैम, बहुत बहुत सुंदर आपने बताया, और प्रेगनेंसी के हर एस्पेक्ट को आपने बहुत क्लियरिफाई किया और उसमें बहुत अच्छे से एक्सप्लेनेशन दिया। और सबसे अच्छा लगा ट्रीटमेंट पोर्शन, जो आपने आयुर्वेदिक वे से बहुत अच्छे से समझाया, और अच्छे योग बताया आपने। और आपने जो अपने गुरु का नाम लिया डॉक्टर ममता केवी, वो मेरी फ्रेंड है, मेरे साथ ही उन्होंने एमडी किया था बीएचयू में। मुझे और आपसे कुछ बहुत एक कहना चाहिए ना कि कुछ अलग सा रिश्ता बना, और बहुत अच्छा लगा आपको सुनना मुझे। तो आपने बहुत अच्छे से एक्सप्लेन किया, मुझे लगा, मुझे कुछ प्राउड फीलिंग हो रही है आपको सुन के, बहुत खुशी लगी, और बहुत अच्छा सा आपने बताया। रियली ग्रेट मैडम, अच्छा लगा।
थैंक यू सो मच।
वेरी नाइस मैम, रियली ग्रेट। थैंक यू सो मच। आयुष दर्पण की तरफ से भी मैं आपका आभार व्यक्त करती हूँ, और हमारे सभी वैद्यों का भी आभार, डॉक्टर बलजोर, डॉक्टर चिकम्मा, डॉक्टर सविता, सुशीला, डॉक्टर स्मिता, वरुण सिंह, डॉक्टर कल्पना, डॉक्टर विमला जी, संपदा जी, अंजना मैम, सभी का आभार बहुत बहुत। और अभी आज के लिए हम लोग रुकते हैं, फिर नमस्कार सभी को, गुड नाइट। थैंक यू मैम। थैंक यू।
थैंक यू मैम।
नमस्कार।
थैंक यू मैम। नमस्कार।